Hello, hello, my friends. Let's see how we are doing right now. All right, hello, my friends. Jill Osborne from the Interstitial Cystitis Network. It is Sunday, March 22nd of 2026, and it is time for another live IC support group meeting. I do these meetings. I try to do these meetings every Sunday, or excluding times when I'm not feeling particularly well, or if I'm having technology issues, or if there's a major holiday. So anyway, today is another day where it is my honor to be here to provide any information that I can that might help you in your journey with bladder and or pelvic pain. Been a very busy week. I've been very busy this morning. Plus, I got to tell you, I ate something that really got me a couple of days ago. So I'm still not back to eating normally yet. Oh, the joys of life, right? The joys of life. Normally, when I do these meetings, I usually do 20 minutes of educational content, and then I'm usually happy to take questions. Honestly, I don't have anything prepared for today. I have just been enjoying, and I know this isn't true for so many of you, but it's been warm and wonderful here in Northern California. It has been 90 degrees, 95 degrees, like heaven after a very cold winter and fall for us. And so I'm just trying to soak in the sun. I am not a happy girl if it's cloudy. I'm not a happy girl if it's foggy. I'm just not. My windows are open. The sun is shining in. And so we've had a very, very unusual 9 months here in California. Now we have this very big heat wave. It was 103 up at my warehouse a couple of days ago, which is insane for March. If you could see the hills outside, they're turning brown. Very bad, so it's like, a double-edged sword. On one hand, I absolutely love the heat. On the other hand, it's signaling what is probably going to be a truly epic and horrific fire season. So it's always something. Hello, Anne. Right now we're streaming on Facebook and on YouTube. Hello, YouTube. Nice to see you. Now, I am here as long as you have questions. Sometimes our meetings last 2 hours. Sometimes they last 5 hours. I am here for as long as you need me to be here. It is springtime though, and it is also Palm Sunday, and I do realize that people are going to be. Hello, Tanya. Nice to see you, my dear. How are you doing? Hello, Anne. Nice to see you too. Let's see here. Oh, okay. And you guys, if we can do a sound check, how is the sound? Facebook, how is your sound? YouTube, how is your sound? Let's make sure we are good from a sound perspective. Let's see, I got to put you up here. You're good. So if you all can just check in and let me know if your sound's okay, I'd really appreciate that. Oh, Facebook. Okay, Facebook is doing what it does every now and then, and that is it's frozen for me. So I need you guys on Facebook to tell me if you can see me and hear me, because my screen is frozen. But that's what Facebook does every now and then. So Tanya says it's okay here, so you're good. You can see me right now, even though it is frozen. Okay, so excellent, Allison. Thank you. Hey, girl, it's nice to see you. I hope that you're doing well. Okay, I know y'all are probably sick of hearing me talk about Elmeron and the eye issues and all that sort of stuff that are going on. We've been doing a really deep dive. We have more and more patients now who are being diagnosed with eye issues and bowel issues. And last week I told the story of one of my clients who got a small settlement for her eye issues. She has just been told that she has to have her bowel removed. She is 79 years old. She called me sobbing in pain, sobbing because she didn't know what to do. Because here's the issue. Number one, she doesn't know if she can survive having a colectomy. Number two, even if she has a colectomy, she doesn't have the freaking eyesight to change the bag. And she is despondent and desperate, and I am furious on her behalf. If there's one thing we know from day one, back when Elmeron was first approved in 1996, there were patients having diarrhea. We were told as support group leaders, tell them to take it out of the capsule. It's the capsule that's a problem. Of course, now we know that there is an association between Elmeron, also known as pentosan polysulfate, and inflammatory bowel disease, and a number of patients are having their bowels removed. I have been sending a lot of feelers out, and I have been diving deep into FDA regulation this week. Because we have settlements now for the eye issues, but we don't have active litigation and or black box warnings yet for the bowel issues. And so I've been sending a lot of feelers out, doing a lot of reading on this. What can we do? And here's the deal. If we're going to get the FDA's attention, y'all got to file your reports with MedWatch. We have to create that foundation of data. So for anybody out there who has suffered from bowel issues with Elmeron, also known as pentosan polysulfate, I will have a link. If you can Google MedWatch, that would be fantastic. You need to file a report. We need hundreds, if not thousands of patients sharing that, yes, they too had bowel issues with this medication. And if you've had colectomies when body parts have been removed, that is a giant red flag for the FDA. So if you've gone so far as to have a colectomy, please file with MedWatch. We've got to get that data out there. The second thing that I'm doing is I'm putting together the first formal patient registry, because we're going to present that data too, because there damn well needs to be a black box warning on that medication showing the risk of bowel issues, in my opinion. This is my opinion. You know, listen, I love being a support group leader. I love it. I've done it for a long time, but you know what? It is hard right now. And it is hard right now because I've got so many patients calling, crying in pain and crying out in frustration, because they were not informed that a medication could cause some of these issues. If you're unfamiliar with Elmeron, the only FDA-approved medication for IC in the United States, there is an article on our website called The Tragic History of IC, of Elmeron, that goes through the history, goes through the FDA approval. Guess what? The FDA denied it for 5 years. The reason why they denied it for 5 years is that the research that was presented showed only one doctor had success with it, the guy who happened to have a financial interest in it. All the other doctors did not have success with it. And the FDA responded to that request and said, well, your data basically says only one doctor can use it successfully. So we need a study that excludes that doctor. Let's not include that doctor. Let's get a lot of other doctors to try it to see if it helps. And if it helps, fantastic. If it doesn't help, then that's important too. And the FDA asked them to do another study, and they met with them to design that study. And the company didn't do it. They didn't appear. I don't know why they didn't do it. I would assume it's financial. I don't know. What they did is they presented compassionate use data. Now, here's the thing. Compassionate use data is given to drugs that companies that apply for medications for which there are few treatment options. I mean, so like with Elmeron, the first thing they did is I think they filed it orphan drug status, if I think that's the correct language. They were granted orphan drug status because there were no treatments for IC, and it gave them a tax break. Okay, so that's reasonable. I don't see any problem with that. Then they applied for compassionate use purposes. Compassionate use, the FDA is very clear, does not mean this medication is safe or effective. It means that there are patients out there with a medical condition for which there are few treatments, and here, let's make this a treatment available, but we can't guarantee that it's safe or effective. Y'all didn't know that. We didn't know that back then. And so Elmra was widely advertised to the IC patient population back then and as a compassionate use thing, and lots of patients got it that way. So anyway, the company presented compassionate use data to the FDA, and that's how it got approved. They never got the study. It took 18 years for that study to be completed. 18 years while this medication was out on the wild. Now we know that it can badly damage eyes, resulting in blindness. Now we know that it has the potential of triggering bowel symptoms. We know that some patients have had to have colectomy. And when that study finally came out in 2014, what do you think it showed? It showed that this medication was not effective. And Curtis Nickel, the guy who led that campaign, one of the most respected researchers in the world, was interviewed by a publication called The Lever that did a big investigative report on medications approved without good data. They all thought it was going to be pulled from the market, but it wasn't. It's still out there right now. There are still doctors right now telling patients it's safe. And you know what the doctors say? The doctors say, well, I haven't seen anybody in my clinic go blind. I haven't seen anybody in my clinic have any bowel issues. Therefore, I think it's safe. Now, listen, the company would not have paid $43 million so far to patients if there weren't an issue. And I'm just tired. I'm tired. Because I have been taking your phone calls for years now. And I want to see action. I want to see informed consent. I want patients to know that the medication that they're being prescribed has issues. You'll have seen these ads on TV where they're advertising new drugs. And at the very end, there's a really high voice, fast voice going, that's talking about all the bad things that can happen. That's not good enough. It's just not good enough. I had somebody call me yesterday that she was prescribed a steroid for something other than her IC. She was very, very worried that it was going to affect her IC. And we went through the research with it. And short-term use, okay, but there are some significant adverse events that can happen, like high blood pressure. Long-term use, not recommended for IC at all. A lot of big risk with long-term steroid administration. So in the end, if, and listen, you're just going to have to bear with me a little bit. I just need to rant. Okay. I just need to rant a little bit. There is nothing more frustrating for me than a patient who calls, who says they've done everything. And I say, okay, what have you done? And they can't tell me. We had bladder installations. What was the installation? I don't know. Wait. You had it. You let somebody put a medicine in your body and you don't know what it does. You don't even know its name. And they'll say, yes. You'd be amazed at how often that happens. You can't do that anymore. Today, you are entitled to know the name of the medication and the risks of the medications before you agree to it. Don't let anybody put anything in your body as a bladder installation until they explain it to you first. And they discuss risk versus benefits. Debbie says, rant, Jill, rant. Normally I am the calm port in the storm. You cannot rely on me. If you're having a crisis, you can call me and I am the calm port in the storm. But I have moments when I just got to let it fly. And today is one of those. So just please, come on. I've got the IC network. It's the largest free archive of IC information in the world. And yes, websites are dinosaurs. And yes, y'all don't want to read stuff anymore. But you got to read stuff. You have to read stuff. I will also tell you that we will be shutting down our forum very, very quickly. I've just hired somebody to copy all the data. I have got the biggest support forum in the world on our website with almost 1 million messages from IC patients. I'm trying to save all that data It is being shut down because y'all aren't using it anymore. And that's okay. I see patients are scattered to the wind. I understand that. It is what we call legacy software. It's from the old days. But I'm not going to pay $5,000 a year to maintain a form that is not really being used. So anyway, I'm going to have it available for research purposes. So we'll still have the data. You can go in and research it, but you're not going to be able to post it anymore. What I am going to do, the other thing we're doing is we're doing this big software migration. It's another reason why I'm a little stressed out right now. And our e-commerce store is going to be switched to a different platform. And I'm going to change up kind of our memberships and things like that. So that's what we're doing right now for the next 2 months, is digging into software. Tanya says, I just met with a new Urogyne and they literally offered Elmeron, even though she said it wasn't her favorite. I showed her my P-leaf and lactoferrin. She knew these, but wasn't the one to offer these. They were mostly procedure-oriented, than offering diet and supplements. And she said it was safe? Did she say it was safe? All right, Johanna. Okay, you guys, challenge me. Listen, it's a good day if I get really passionate about something. So please feel free to challenge me about anything. Everything's on the table. I dare you to try to embarrass me. I like to think, listen, back in my 20s, I had trouble talking about personal things. I can talk about personal things now. So I dare you to challenge me and try to get me to blush and get embarrassed. Okay, so here, hold on a sec. Debbie was just told she had a nodule in her right eye, Debbie, and that you didn't know that affected the bowel as well. Debbie, here, you know what? Hold on a sec. I want to email the lead eye researcher right now for Elmeron while I'm thinking about it. So hold on a sec. Let me just email him right now. And I'm going to ask if they've seen nodules on eyes. Okay. So hold on a sec. Let's see. There it is. Nodules on eyes. I am doing a live IC support group meeting. And we have a patient who was just told that she had a nodule on one of her eyes. One of her eyes. Okay, Debbie, you took Elmeron, right? I mean, I just want to confirm you took Elmeron before I hit send on that. And thank you. Yes, my hair is kind of good today. Joan says, what do I think about Hyprex? Hyprex is not a treatment that is listed as for the treatment of IC at all. Let me look up a thing. Is it methenamine? Yeah, it's a methenamine. Okay, so here's my perspective on medications like Hyprex and methenamine products. You have to understand that interstitial cystitis patients are very difficult for doctors to care for. We have to accept that. IC patients are frustrating to care for. It takes a lot of work to care for us because a big diagnostic workup, we gotta do, there's a lot of extra testing that has to be done to make sure that you don't have Hunner's lesions, you don't have a recurring infection, you don't have pelvic floor, you don't have pudendal neuralgia, nerve blocks, things like that, right? So there's a fairly rigorous diagnostic workup. We also have to remember that urologists or surgeons, they love to do surgery. And IC patients are not normally surgical patients. So treating an IC patient is not an adrenaline high for a doctor. It doesn't get them excited like surgery does. And you can't blame them for that, guys. You cannot blame them for that at all. Doctors that go into urology are often some of the best surgeons you're going to find in med school. They go into it specifically because they love to do surgery. They didn't go into it to treat a chronic pain patient like us. And so there's a level of frustration that goes on with that. We certainly know that there are doctors who don't want to treat IC. If you call and say, hey, I'm an IC patient, I'm looking for care, they're going to say, we're sorry, we don't treat IC, which is why I always say, don't say you have IC. Number one, IC is a grab bag diagnosis. It means you got frequency, urgency, pressure, pain, but they don't necessarily know why. Right? We don't think of IC as an incurable bladder disease anymore. We think of IC as a pelvic pain syndrome, for which there are many other causes. So I always tell patients, if you've gotten one doctor who said, I don't treat IC, next doctor, don't even say IC. Say you've got pelvic pain. Say you're a pelvic pain patient. Like I was working with a patient last week who's having urethral pain, just really bad urethral pain. And then some of her symptoms, pain shooting down her leg, pain in her lower back, pain when sitting that got better when standing, and I was like telling her, you do realize that the bladder's not causing that. The bladder doesn't cause pain shooting down your leg. Muscles and nerves do. You're a pelvic pain patient. So ask for pelvic pain care. That's a way of kind of getting in the door and it's more correct anyway. It's a more correct way of working with your doctor. You are a mystery to be solved. You are an anatomical mystery to be solved. Our goal is not just to treat the symptoms, to find the underlying cause of the symptoms, whether that be a Hunner's lesion on the bladder, whether that be endometriosis on the bladder, whether that be pelvic congestion syndrome, tight muscles, whatever. Okay, but getting back to methenamine. Methenamine is an easy way to get you out of the office. That's my opinion. Methenamine is broken down into formaldehyde in your urine. So methenamine's appropriate use is to kill bacteria. But most of us don't have bacteria. Most of us, 87% of IC patients are pelvic floor muscle driven, right? And when you're the patient, you're in there, you're crying, give me something, anything, give me something. I just want it to go away. They're like going, okay, I can do this. Oh, let's try some methenamine. And you're like going, yeah, I got something. And then you take it home and you take it and you're not better. It doesn't do anything, which is very, very common. But again, if you're a recurring UTI patient, methenamine is a legit appropriate treatment. But again, methenamine is not mentioned for IC. So to summarize my little blurb there are doctors who don't have the time to listen to us. There are doctors who don't have the interest and might not want to listen to us. And then sometimes patients make the mistake of going in and just saying, I don't care what you give me, just give me something. All three inevitably will lead to wasted prescriptions that in the end probably won't get you where you want to be, because where we want to be is finding the underlying cause and treating the underlying cause. And that is exactly why we phenotype, because when we phenotype, we can find the underlying cause of your symptoms and we can treat the underlying cause of your symptoms and get you better. You have to remember that, there's no problem with managing symptoms. Listen, the symptoms of IC are brutal. The pain of IC is rated equivalent to terminal cancer pain. I used to live with that pain every day. I completely understand the importance of treating that pain. Pain left untreated creates desperation. it's very easy to focus. How do I want to say this? Let's see. I want to say this the right way. I had a husband call me. Wife had IC. Laying in bed, completely, basically bedbound, unwilling, unable to engage with family, unable to take your kids to school, make food. And he was just at his wit's end. It's like she just laid there. I don't have a wife anymore. She's doing nothing. And I thought, all right, let me talk to her. I'd be more than happy to talk to her. I'm happy to talk to anybody. Get her on the phone. And it's like, all right, hun. So I'm Jill. I'm a support group leader. Your husband called me because he's really, really worried about you. What's going on? And she said she had been diagnosed with IC. And she was suffering from very, very bad pain. Didn't know anything about it at all. She didn't know about the diet. She really didn't know about anything. And so what she had was a lot of pain medicine. She was taking a lot of pain medicine. Like, I understand that. I took a lot of pain medicine. Now we got to try to figure out why you're in pain in the first place, because if we can get rid of the pain, you won't need the pain meds. And so we start going through the diet. It's like, okay, number one, clearly you're having bladder wall symptoms. Your bladder's screaming at you. So the first thing we got to do is protect the bladder. Try to get it to calm down. Try to reduce some of that inflammation. So do you know about the IC diet? She goes, no. And I'm like, okay, so here's the deal. Let's not pour acid on the wound. Your bladder's very wounded. It's screaming at you. So no acid, no alcohol. So that means no soda. No cranberry juice, no orange juice, just no lemonade, no lime, no, pineapple juice, tomato juice, stuff like that. Well, let me tell you, she was furious with me. It's like, oh, hell no, I'm not giving up my diet soda. I love my diet soda. She loved her diet soda so much, that's all she drank all day. She didn't drink water. She only drank diet soda. At least a 6-pack a day, if not more. And I said to her, okay, if you had a wound on your hand, would you pour diet soda on it? She's like, no. I said, well, what do you think would happen to that wound if you poured diet soda on it every single day? And she didn't like the direction I was going, starting to get very angry at me. And I said, the wound wouldn't heal. If you pour acid on it every day, the wound would never heal. You're just re-injuring it. And probably the wound would get bigger and bigger and bigger. So step number one for anybody with bladder wall driven symptoms like you have is let's just lose the soda. Let's just calm it all down. Go back to water, chamomile herbal tea, peppermint herbal tea, milkshakes. Have a milkshake, vanilla milkshake. You're good. You can do a vanilla milkshake. And she was furious with me and said, I'm not giving up my Diet Coke. It's the only thing I'm living for right now. I mean, I've had a couple conversations like that. And I said to her, you don't want to be engaged with your family? You don't want to take your kids to school? You don't want to do that? And and her answer, quite honestly, was, no, I don't. I just want my pain meds and I want my Diet Coke. That, my friends, is a sign of an addict. She was very, very addicted. He called me back about a month later and said, oh, it's just as bad, if not worse. And I'm like, put her on the phone. He's like, she won't talk to you. She's not giving up her diet soda and her Coke. I have no idea what happened to her. So anyway, we have to make the commitment to learn about it. We have to make the commitment to learn what we can do at home to make it better. And no longer look at a doctor as a god, as a doctor who's going to suddenly make it all better. Man, you got to walk in there fully engaged, informed, ready to have a really good discussion about what your underlying cause is and what your treatments are. Because we don't want to do decades on a medication that has no chance of helping you. I did everything. I did all the bladder treatments, except I never did Elmeron because as a pharmacologist, it never made sense to me. It's like if you swallowed a Band-Aid, would you expect it to come out the other end of Band-Aid? And the answer, of course, is no, we have digestion. So I chose not to take Elmeron. But this is what I can tell you. Every bladder treatment I did, every antidepressant that I did, every antihistamine that I did, never fixed it. What fixed it and made it better was physical therapy, because my pelvic floor was very, very tight at the time. Physical therapy is a valid, valuable, effective treatment for many, if not most of us, without significant side effects. All right. Oh, Johanna says, were you able to watch your show BTS? Yes. At 4 a.m. yesterday, I watched the inaugural concert of BTS. And now they are in New York, and they're going to be on Jimmy Fallon this week, and I'm really excited. I am Army. I'm a senior Army. I love BTS. And they were looking so good. Tanya said she didn't know about the forum. Debbie says, yeah. Well, forum, most of the forums on the internet are dead. And who is I talking? I was talking with, we're going to start working with a new company who reached out to me out of the blue. And I'm not going to say what they do, but it's real legit, it's really going to help with diagnosis. And we were talking about what the trends are right now. And the trend is people don't go to websites, and people certainly don't use forums anymore. Most of the forums are dead in the water. What people want are video, preferably short videos that are funny. And it's like, yeah, how do we handle pelvic pain with short videos? It's tricky. John says she was given Hyprex 2 times a day for UTI prevention. Yeah. Sharon says, can IC make you feel pounding pain in that whole area? Yes, it can, but your use of the word pounding is interesting. So I would love for you to try to describe that pain a little bit more, Sharon. Is the pain centered, or is it to the left or right of center? Is the pain external or internal? If the pain is internal, where is its center? Is it in the urethra? Is it in the vagina? Is it in the rectum? Or is it in the bladder? Pounding pain. I would say that when I was absolutely at my worst, and that day was July 4th, 1993. I will never forget that day. I couldn't sit. I couldn't stand. I couldn't lay down. It was like my pelvis was on fire. All I could do was walk in circles. And I walked in circles all day. I finally got some pain medicine. Did I have pain medicine by then? I had no pain care for a year. And then finally, when I was at the ER, they gave me Vicodin. And it's like, whoa, who knew you could turn off all these bladder symptoms and pain with a little bit of pain medicine? So pounding pain, I would say that a very, 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 very severe bladder wall flare could do that. And I also think a very severe pelvic floor flare could do that. I'm trying to think. So like, I'm a pelvic floor patient, no doubt about that. If I have to travel and fly, oh, Linda, hold that thought for a moment. I will always flare. I will always have pelvic floor spasms on the bus to San Francisco International Airport. I've never not arrived at the airport not in pain, even now, because my pelvic floor does not like to be in a bouncing bus. And so I pre-medicate with a antispasmodic or a muscle relaxant, usually Flexeril, for the entire trip. So is that pounding pain? Yeah, that's a good descriptor. Interesting. Linda said, I haven't been able to comment. Finally got through. You two have some kind of nodule on my retina. You were on Elmeron for 19 years. Okay, let me go back to my email to that doctor. Now that I've got 2 people in here, let's do that. Doing a live support group meeting and have 2 patients in my meeting. Both, I believe, were on Elmeron, who now have nodules on their eyes. Have you seen this in any of your other patients? All right, I'm sending that off to him. Okay, so one of the things we know is that for patients who have developed inflammatory, and so hold on a sec, wait a second, I just moved a window. That's a bad thing. I got to find my Facebook window. Hold on. Where did it go? There it is. Oh, it's working again. Yay. So for the patients who have had bowel issues, they're developing polyps on their bowel, not just 1 or 2 polyps. Where the trend is you start out with 1 or 2, then the next time they go, they're like 6 or 7. So they remove their 1 or 2, usually benign. Then they go back and look and they find more, and they find the ones that were removed appear to have grown back. And then 2 to 3 years later, it's gone from 5 or 6 to 20 or 30. A patient I was working with has had 100 polyps removed in the last 3 years. And she's the one I was talking about earlier, where her doctor just said, listen, we got to take these out. She had carpet polyps. Carpet polyps are, your bowel starts to look like it's a living carpet of polyps. There are 2 different types of polyps that can happen. There's a polyp that has a stem that kind of looks like a mushroom. Those are the most common polyps. Carpet polyps are the flatter polyps, and the kind of live right on the surface of the bowel. And carpet polyps are more strongly linked to becoming precancerous. And so any finding of carpet polyps is concerning. And most of the patients who have had colectomies that I've worked with have had carpet polyps. But the thing is we don't understand how or why that would happen. Like, why would this medication cause that? We have one person who has, and I don't want to say too much about it because we haven't verified it yet, but she's saying that different parts of her body, they believe, are being attacked by the medication. We just don't know. We don't know. That is her guess. That is just a guess. But is a nodule on an eye similar to a polyp in the bowel? I don't know. I just don't know. There's so much we don't know. Tanya said, I'm so curious if fibromyalgia can affect IC. I've had a bad flare in many tissues of my body, even my pubic bone area aches. The tissues are sore. I also have bad estrogen atrophy with frequency because I drink a lot of water. Okay. So fibromyalgia is one of the chronic overlapping pain conditions And so that's our widespread pain phenotype. So these are patients who they might have IC, they might have IBS, they might have vulvodynia, they might have fibromyalgia, they might have TMJ, they might have migraines. If you've got 2 or more of these conditions, your official diagnosis is chronic overlapping pain conditions, also known as widespread pain. The connection between them is the nervous system. That the foundation for all of this nerve sensitivity is essentially the central nervous system and perhaps an injury to the central nervous system. So your question is kind of backwards. If fibro can affect IC, the answer is that nerve sensitization can cause both fibromyalgia and IC and IBS and vulvodynia. Now your pubic bone area aching, that strongly focuses instead on the pelvic floor. And I would want to know, Tanya, what's going on with your pelvic floor? Yeah. Okay. You're going to call this week about compounded estrogen. My uro will order if I get all the info and contact. Sure. Isabel. Hello, Isabel from Canada. I'm having a major flare-up for urgency pain, frequent urination, urinalysis, negative as usual. Tried Cysto+ and D-Manos, no help. I wouldn't expect either one of those to help. Was prescribed Pyridium here, which is very hard to find here in Canada. They can order it for me. It's very expensive, honey. It's over the counter. I mean, we can send it to you. It's called Azo urinary pain relief tablets. That's the over-the-counter generic version. Would I recommend that you go ahead and try it? This has been going on for 2 weeks, watching my diet. I have a book on IC. You're only taking Tylenol for pain. Okay, Isabel. This is the book you need. This is our flare guide. Because we have to figure out the type of flare you're having, hun, because they're not all the same. You could be having a bladder wall flare. You could be having a pelvic floor flare. You could be having a hormone flare. You could be having a stress flare. You could be having a urethral flare. There are lots of different types of flares. And so, for example, D-Manos is only applicable if you have a history of recurring E. coli infections. Otherwise, it's a waste. I'm not sure what Cysto+ is. Let me see if I can find that. And the ICN Flare Guide is available on the IC Network website. It's $16.95, 80 pages, 30 years of information on flares, all right here. I worked my tush off on it last fall. I'm really, really proud of it. Okay, so, and I wrote the first flare guide 10 years ago also. So let me see if I can look at Cysto+ here. Cysto+ is a sodium citrate. What? No, this makes no sense. So it uses sodium citrate to raise urine pH to reduce burning, stinging, and pain of infection within 48 hours. So again, they've given you something for infection. But we don't know if you have infection. I mean, we have to assume that they've checked your urine. And if they've checked your urine and it's negative, why are you doing anti-infection stuff? Instead, if it's, let's just say, it could be, number one, a bladder wall flare. So bladder wall flares happen when the bladder wall gets injured or irritated, especially if you're older and you're in estrogen atrophy. So if you drank, let's say you went out with some friends to a restaurant, you ate something, spaghetti, that really irritated your bladder wall, and God forbid you had a glass of wine at the same time, that could cause a very severe bladder wall flare. The acid and the alcohol have irritated the bladder wall. That's not infection, that's injury. So what are we going to do for that? The first thing we're going to do is neutralize the acid. And the way we do that is with pre-leaf or baking soda. But you don't want to use a lot of baking soda because that can raise your blood pressure. Instead, pre-leaf or Tums, just taking a Tums or two would be great to reduce the higher acid levels in your urine. Okay, the second thing we're going to do is dilute your urine. So you've got to increase some water. Get some water in there, reduce any of the irritants in your urine, any of the residual acid, right? Then at the same time doing pyridium, but doing it in the form of azourinary pain relief tablets, which is not expensive at all. Here, I have it. I have it somewhere. Anyway, listen, it's in the IC Network shop. It's right on the front page. And again, we ship to Canada every day. We can absolutely ship it to you. And that's going to numb your bladder wall and it's going to turn your urine orange. So understand too that orange can stain. And when you're taking it, if the doctor suspects you have an infection, it's going to mess up UTI results. So make sure you have your urine culture before you start it. And then you've got to write it out. You have to, they can give you a bladder installation. They can do a rescue installation with some lidocaine and some Elmeron. No, not Elmeron, heparin. Lidocaine and heparin to numb the bladder wall to help it calm down. You could do Allopath, an aloe product. This is the only place where I am in support of aloe. So there is no research that shows that aloe helps IC or the bladder in any legitimate published medical journal. Aloe is soothing to a sunburn. So you can put aloe on your arm if you have a sunburn. But the thing is, you have to keep reapplying it because it rinses off. Aloe can be soothing for the bladder wall. And so taking aloe for a couple of days, not a bad idea to just try to soothe out the bladder wall. But I cannot justify using aloe long term because the bladder is not made of aloe. It's not going to help the bladder repair itself in any significant way. It's just soothing. And so you could do aloe. We have the aloe that I suggest is called Allopath. Allopath combines organic anthraquinone-free aloe with PEA to calm nerves down. So it's not just the aloe, it's the PEA. I think that is the superior aloe on the market today. So you could do a little bit of Allopath for a bladder wall flare, but in the end, you're just going to have to write it out. That typical bladder wall flare. Again, assuming that they've already ruled out infection, assuming that you don't have a lot of blood in your urine, But if it's a pelvic floor flare, your approach is going to be very, very different because the pelvic floor flare is being driven by very, very tight muscles. And so what are we going to do here? We're going to do things that will relax muscles over time. And so in this guide, so here's our pelvic floor flare section, right? And I go through, so what are we going to do for a pelvic flare? Well, let's see, what's going to cause a pelvic floor flare? What are the triggers? Falling on the pelvis, stumbles, sports injuries from weightlifting, spinning, football, gymnastics, ice skating, and/or sports that impact the pelvic floor. Even ballet. I was working with a ballerina this week too who had pretty bad pelvic floor dysfunction. Sitting for long periods of time can compress the muscles and trigger a pelvic floor flare. Traveling, if you're sitting and vibrating on a plane or on a bus, that can trigger a pelvic floor flare. Sex can trigger a pelvic floor flare. And of course, stress can trigger a pelvic floor flare. When you're in fight or flight, your muscles are going to tighten to help you run for your life, etc. So what are we going to do? What's a pelvic floor rescue plan? Number one, take a walk. Movement and gentle exercise releases accumulated stress and improves circulation. If it's not painful, take a walk around your house, your garden, or your neighborhood. If you're feeling comfortable with it, walk more quickly for an extra cardio. Number two, heat or cold. Heat relaxes muscles. I sleep with a heating pad. I do. I have slept with a heating pad for the last 40 years. It feels good. I like it. My body craves heat. If my muscles are tight, my body craves heat. Ice does not work for me. If you're craving ice, that coolness, that usually means that we're dealing with irritated nerves rather than irritated muscles. So that's something to throw out. You could do some over-the-counter analgesics like Advil. But then we're going to dive right into some stretches, things that can relax the pelvic floor, from a basic deep breathing to the garland pose. Now, this pose right here, where you're literally sitting on your ankles. So if you're having a pelvic floor in the bank, you're sitting there and that your pelvic floor is spasming and it feels awful, drop your car keys. Drop your car keys on the floor, squat down, and just be there for a couple of seconds. This body position puts these muscles exactly where they're supposed to be. It is remarkably helpful. A happy baby is a great pose. Cobbler pose is great for relaxing the pelvic floor. Forward bend, warrior. Anyway, we're going to do these. And of course, you're going to use a wand. This is what I do. In fact, I did it a couple of days ago. I could feel my muscles locking down pretty darn tight. Oh, I've been kind of stressed out this week. Not kind of. I've been extremely stressed out this week. I could feel it. I started feeling rectal pain. That is my number one symptom. I also know how my muscles are by how I pee. If I cannot pee on command, there's a lot of hesitating, stopping and starting. I know my muscles are starting to get funky. I whip out my wand. Now, the way I do it is I lay on my bed. I put my feet up on the wall. This is I use this vaginally. And what I'm doing is I'm looking for tender muscles, and you do one side at a time. You don't go back and forth. It doesn't work that way. With pelvic floor work, you have to visualize your tailbone because your muscles attach to your tailbone. A lot of muscles do. So if you're laying on your back and your knees are up, your tailbone is your foundational center. You're going to go on the left side because you got muscles that go from the tailbone up to the left hip, and you got muscles that go off the right side up to the right hip and various areas. And so you're always going to start, and the sit bone's in there too, and it's got a lot of muscles too. So you're going to do one side at a time, and you're looking for those tender points. And interestingly for me, my left side, which is normally my tight side, was fine. It was my darn right side that was very tender to touch. And I massaged it for a couple of minutes with this, and it made it go away. Okay. You can do an oral muscle relaxant like Flexeril, Baclofen. And of course, if those muscles are continuing to stay tight, then you get yourself off to a physical therapist to try to understand why. And when you're working with a physical therapist, my friends, and I was working with somebody this week who only did physical therapy for 2 months, and she gave up. Which is so frustrating because for many of us, this is an old injury. You know, this is something that happened a long time ago. We have muscles that have been tight for many, many years. And listen, 4 visits to the physical therapist is not going to make it go away right away. You got to stick to it. And you have to work with that physical therapist, and you have to ask that physical therapist, are my muscles responding to therapy? If they are, great, you're doing good. Keep it up. But if your muscles are always tight, no matter what they do, then that raises another really important question. And that is, what is putting stress on those muscles? Because that's a physical stressor. And what puts stress on muscles? Bones. So it could be like, for me, I have a funky SI joint that moves too much, so my muscles lock down tight to stabilize the joint. I was working with a patient this week who she'd just been told that one of her hips was rotated. That's going to put stress on a pelvic floor. If you've had a broken tailbone, that's going to put stress on the pelvic floor. If you've got a bad knee and you're limping, that's going to put stress on your pelvic floor. But most importantly, what we're seeing now for the patients whose muscles are always staying tight, it's how they walk. If you have toes that go out, if you have toes that go in, if you have Morton's toe, where your second toe is longer than your first toe, that messes up everything, believe it or not. And I can explain exactly why that messes it up. But getting yourself to a podiatrist is often very, very helpful, and or just improving the shoes you're wearing. So I was working with a guy, who was, so he'd been to the physical therapist. The physical therapist said his muscles were really bad, like really, really bad. Works at home, goes up and down a lot of stairs. Going upstairs can really mess with the pelvic floor, so we're going to try to reduce those trips a little bit. But in the end, what I said is, let's improve your shoe quality. Because he was wearing flip-flops. Like, that's not necessarily gonna help stabilize your pelvic floor and your legs and your muscles in general. All right, hold on a second. I wear my Hokas. Every day I wear Hokas. And then the shoes that I wear when I'm not wearing my Hokas are these. I love these. I used to love my Tevas, but these I can wear these all day and my feet love them and they don't hurt my pelvic floor at all. So these Nike flip-flops, I think I got it at one of the big sports stores. What's the name of that store? I don't remember the name of that store. It'll come to me. Bob's? No. I can picture it. It's a short name. Okay. Sharon says, so soda and caffeine. Yeah, those are bad. Okay. Isabel said, I have fibromyalgia and diagnosed with overactive bladder post-cystoscopy last year. So you have overactive bladder, it's irritated nerves. There you go. Linda said, I can't tell you how many times I've had that same conversation, people telling me they will never give up their coffee or sodas or whatever. Exactly. And what I say to them is, you'll never get better. Because ultimately, in the end, this is about how does the bladder tissue repair itself. The bladder is composed of the largest single cells in the human body. Here it is. Okay. So here's a three-dimensional look at the bladder wall. And this is one of the old Elmeron educational materials. So it's just a wonderful way of looking at the bladder wall. So we have the gag layer here, and underneath the gag layer, we have the urothelium. These are the largest single cells in the human body. And they have what we call very, very tight junctions. They're very tight, so urine cannot get through down to the nerves. The green things are the nerves and the blood supply and the other tissue, right? So what happens when one of these cells is damaged? Though these cells can be damaged by infection. These cells can be damaged by chemical exposure. So when one of these cells is damaged, there's a little tiny stem cell. So think extra large pizza and then a single green pea underneath that pizza. So that extra large pizza is the umbrella cell. That green pea is the stem cell. That's the cell that's going to get turned on to become the next umbrella cell. It takes that cell, that pea, 2 weeks to grow and change shape and fit into this spot. So it becomes part of this barrier. And I was in a lecture at the National Institutes of Health about this, and what Dr. Anthony Schaefer, who taught that class, said, that while that stem cell is growing to become that next cell, it is exquisitely vulnerable to acid. That literally one soda will destroy an entire generation of cells. Thus, if you are drinking soda or coffee every day, you are destroying the scab that's trying to heal your bladder, for lack of a better term. It will be impossible for the bladder to repair itself if you are destroying the stem cells every single day. You're just stuck in a vicious loop. A little bit of growth, kill it. Little bit of growth, kill it. Little bit of growth, kill it. Never get better. And he said that. And, we all the patient advocates that were there, we were all looking at each other. I mean, I distinctly remember it because it was in Washington, D.C. It was in Alexandria, actually. And we were all looking at each other going, yeah, we knew that. Yeah, we already knew that. We already knew that the patients who suffer the worst were the patients who had 1 cup of coffee or soda a day. Because they're thinking it's fine. It's like it's not fine if it's preventing your bladder from healing. That's why it's very important that you go off of that for like 6 months and just give your bladder time to repair itself. You have to give it time to repair itself. And there was another study that came out and this other study was saying 6 months. That it would take 6 months for the bladder wall to completely repair itself. So it's Linda, man, that's an argument you can use to the patients who don't want to give it up. It's like, do you want your bladder to heal or not? If you don't want it to heal and you want to keep throwing all your money away on treatments that will never help because you're pouring acid on the wound every day, fine. Sandra said, I need help. I've had a fulguration twice. Second time didn't work. My doc wants to try cyclosporin. Have you heard of valacyclovir being used for Hunner's lesions? I have. Let me hold on. I just have to try to remember the context. Okay, so valacyclovir is also known as a Valtrex. It's an antiviral medication. It's used to treat herpes, genital herpes, cold sores, shingles, etc., by inhibiting viral DNA synthesis. All right, it stops the virus from multiplying. Now, why you would be asking, why would we use an antiviral for Hunner's lesions? Because we now have research that has directly linked Hunner's lesions to viral infections, specifically Epstein-Barr and polyoma JC, polyoma BK. And of course, we also know that HPV can happen. I was working with a patient who had HPV-driven urethral cancer, and they ended up removing her urethra and her bladder and a total hysterectomy. So viruses, Sandra, we now know can infect the bladder. Our own MAP research network at the National Institutes of Health, that big IC research team, they actually found virus in roughly 5% of urine samples of IC patients. And what is the percentage of Hunner's lesion patients? About 5% of IC patients. So if you have a test that has confirmed an active viral infection, hell yeah, do it. Do we have research behind it? Yes, we do. The last time I saw it, I'm going to say it was like 2 years ago at the American Urology Association annual meeting. New researchers came in with a new study where they looked for virus, and if they found virus in patients with IC, they treated them with Valtrex. And at the end of that study, every patient they treated, the virus could no longer be found. I don't remember what that study said about the condition of the bladder wall. But I think that there's nothing unusual about that. I think that's very, very innovative thinking to consider looking for viral infections. And if they find it, to treat it. Otherwise, the cyclosporin is certainly a valid therapy for Hunner's lesions that are not responding. And also, Sandra, just so you know, we've also now linked Hunner's lesions to a damaged or broken ligament. The uterosacral ligament happens, which is a ligament that holds your vagina in place and your uterus in place. When that ligament is broken or stretched out or damaged, what happens is it also irritates the nerves that rest on top of that ligament. So you've got nerves that come from your bladder and go up to your spinal cord. And those nerves happen to rest on top of the ligament. The ligament's kind of like a placeholder. So when that ligament is damaged, the nerves get stretched. And when the nerves get stretched, the nerves become very, very inflamed. This is called posterior fornix syndrome, and this too has been linked to the development of Hunner's lesions. It's very, very easy to check for. There's an article on our website about it. So posterior fornix, Fornix syndrome. That's something else that I would want to check you for. We had a fabulous case study of a woman who had severe Hunner's lesion. She had a severe prolapse. She couldn't urinate on command, or she couldn't urinate easily. So they went in surgically to repair the prolapse. That's when they found the broken ligament. Her uterus was backwards because it was free swinging on one ligament because the other ligament was broken. So like this ligament was gone, so her uterus was doing this. So when they got everything back where it's supposed to be and the uterus was in place, post-op, something absolutely amazing happened. Her lesions disappeared. She is considered a complete and total cure. And the funny thing, too, is posterior fornix syndrome was first discovered in 1991. They knew back then it could cause frequency urgency pain. They knew it linked to the bladder. But, of course, urologists don't like doctors of other specialties telling them what to do. And so here you've got this group of researchers saying, please, please check this ligament, your patients you're diagnosing with IC. Let's just make sure this ligament is an issue. And, many urologists just don't want to do that. Or they don't even know. They've never been trained about it because that's not part of the IC training protocol. Those same researchers are now proposing that posterior fornix be a unique and independent phenotype of IC. I agree with that. I have now worked with many patients, not many, several patients who have had posterior fornix syndrome. Sharon said, the pounding, I feel like my body is moving from the inside. Sharon, if you have a vibration, a fluttering in your pelvis, that's usually a muscle nerve thing. Allison said, I was prescribed Elmeron in November, previously used amitriptyline, hydroxyzine, and cystitis with great success, but October from nowhere pain and incontinence happened embarrassing along with gastritis, esophagitis. Through amitriptyline, so we were mentioned to a consultant, the recommended Elmeron. Botox was refused, but you're trying Elmeron, but only twice a day. You've had the eye test and it's okay, but do not like taking it. Wonder whether it's worth asking to try Ialuril instead of Cystastat and stop the Elmeron. Yes, hard yes on that. I mean, Allison, you got to do your reading on these risks. We have patients who reported changes in their vision in the first year of use. And in fact, we talked about this last week or the week before. The previous assumption, in fact, I've got the paper right here. Pigmentary maculopathy in patients with interstitial cystitis and the association of Pitocin with other therapies. So the assumption was that you had to take a lot of it over a long period of time. So originally they thought it was like, over 10 years. But then if you look at the black box warning on it, it's 3 years. And in our study of 2,000 patients, we have patients reporting changes in their vision in the first year. But this is the first paper to show that patients who have had very, very, very low doses. One patient in particular who got Elmeron as part of a bladder installation, he was only exposed to roughly 5 to 6 grams of it total. And he has mild pigmentary maculopathy from that. And again, he never took it by mouth. He took it as a bladder install. We also know that 3 patients who had Elmeron injections for arthritis also now have retinal damage from it. And then you can't even just throw in the bowel issue. So go on over to the IC Network website, Allison, and right on the front page, there's an article called The Tragic History of Elmeron. Would you please read that? You need to read that so that you can see the history the eye issues, the history, the bowel issues, so that you can make a truly informed decision about if you want to attempt this medicine or not. Because in the end, it's a Band-Aid. It's a Band-Aid. It's a chemical coating. This is the way they position this on this. Is you can see they used to use a dump truck, actually. They should, in their marketing material, that this part is supposed to be the Elmeron right here. So without it, irritants in urine reach the bladder wall and irritate the bladder wall. With it, it's supposed to coat the bladder. So it's basically a chemical Band-Aid. But you have to keep taking it. It doesn't fix anything. It's like putting a Band-Aid on your skin. It's just a protectant. We still would like to know what your phenotype is, what is driving this flare in the first place, so that we can fix that properly. So again, this flare guide or our IC 101 book would be a great thing for you to invest in so that you can understand the connection. So Ioloril actually has an excellent research results. It's a combination of sodium hyaluronate and chondroitin as a bladder installation. It was found in research to be more effective than cystistat. It's basically cystistat and what was the other name for it? Anyway, it's basically 2 medications instead of 1 in a bladder installation. But I want to know what's going on with your pelvic floor. I want to know. I can't tell by your picture, but you might be a little bit on the older side, maybe. Unless that's you with your mom. You might be an estrogen atrophy patient. And if you're an estrogen atrophy patient, what that means is that your skin has gotten very dry. That nice, thick mucosal layer, again, this layer can't grow because it doesn't have enough estrogen to make it grow because we're older. I mean, I'm in estrogen atrophy too. And so treatment number 1 for GSM estrogen atrophy is estrogen. When you give that skin estrogen, it plumps up and starts to make mucus. Then the second thing you could do, instead of doing Elmeron, you could do, here, look at this. This is the new label for Bladder Builder. Bladder Builder is a chondroitin supplement that also acts to kind of protect and coat the bladder, but it's got other things in it too that can be quite helpful, like quercetin, which has an antihistaminic effect. And most importantly, it has palmitoyl ethanolamide, PEA, this, or this, which is known for calming nerves down and reducing pain. So this right now has the best reviews for a bladder supplement for IC. So Bladder Builder. And for those of you who are following Peora and P-Leaf, same thing, made by different companies, slightly different formulas, but they're basically the same. P-Leaf right now you can get on Amazon and it's 30% off. So if you want to try it, what the IC study in 2019 showed, that 87% of patients who use PEA reported a significant and progressive reduction in pain. It is what I take. It acts by calming nerves down. So it's like, and when they presented that research, the doctors were so excited because here's something that has been tested with many, many, many different types of pain, conditions of pain, surgical pain, acute pain, chronic pain, shingles, burning mouth syndrome, IC, excellent safety profile, no addiction, there were no side effects in the IC study. And these have been truly life-changing for many of us. So it's like a natural version of gabapentin without the side effects. It's kind of they're not a direct comparison, but it's an option and it's very, very affordable and might be worth trying if you're struggling with pain. Allison, if you want to give me a phone call this week, I'd be happy to talk with you and try to figure out what kind of flare you're having. Joan says, you went to pelvic therapy each time, and every time you went, you got a UTI. For sure? Was it for sure UTI, or did it just feel like a UTI, Joan? It's very common to, when they start working with muscles, that for muscles to react, and it might feel like an infection, even if it's not an infection. It's a flare. And you have to tell the physical therapist so that they back off, and they have to be more gentle. If it is a legit UTI every single time, then that speaks to a couple of different things. We want to make sure that they're using the glove. I don't see how they would not be using gloves. Oftentimes, vaginal infections can become bladder infections. What research shows is if you've had 2 infections in 6 months, 3 infections in a year, you are officially in the complex UTI group, also known as a recurring UTI. And a lot of research has been done on this. And what they consistently found in these patients is that 24 hours before the bacteria arrives in the bladder, it's living very happily in the vagina. This then led the researchers to ask, well, what's happened to our vaginal defenses? Hello, aging and estrogen atrophy. So we want to try to get the vagina stronger and more resilient and more able to fight off infection. And that's where vaginal estrogen comes. And so normally you would be given an antibiotic and an estrogen product to make sure your vaginal tissue is moist and able to protect itself. Tanya, getting back to you, honey, again, PEA would be a very interesting experiment for all of your issues because you're in that widespread pain group. And this is what we suggest for widespread pain now. Anything that can calm nerves down. Allison says, can you order from the IC store and deliver to the United Kingdom? The answer is a hard no. We cannot. What you should do is make a friend online. Make a friend in America online and ask them to place your order. I can send it to them and then they can send it to you as a gift. I cannot send it to you. I do have some recommendation. I do have an Amazon UK store. I'm trying to do Amazon stores for all the international countries with similar products that you can get right in your country. I just haven't had the time to update them. I've been really, really busy, but I promise you I will get to it. I will have an Amazon EU. I will have an Amazon Canada. I will have an Amazon UK because listen, times are, you guys, are you sitting down? Would you like to know how much gas was at one gas station up in Healdsburg, the wine country, a couple days ago? $6.15 a gallon. Now, where I live, it's in the 540s to 580s. It's crazy times right now. Do not even get me started. Oh my God. Especially about Amazon. Amazon, death by 1,000 cuts for any small business. You would not believe. They are just destroying the entire infrastructure of small businesses. It's heartbreaking. They charge so much money and they just pick and pick and pick. Oh, Christy connected with the Women's International Pharmacy, now known as Belmar. Her Urogynecon called it in and you received it this week. Your doctor already knew about them, the former Women's International Pharmacy. Yes, excellent. So for anybody who needs compounded estrogen cream, if you find that your estrogen cream is burning or irritating you, You might benefit from a preservative-free formula. And my gynecologist suggested that I use the Women's International Pharmacy. They don't pay me to recommend them, guys. I have no relationship with them at all. I will just tell you is that's where I get my estrogen. That's where every woman in my family gets their estrogen. It's preservative-free, easy to work with, reliable, affordable. So you can just search for women'sinternational.com or just go to women'sinternational.com and they'll take you right over. They have a new name now. It's called Belmar. Same company, great service. Tanya said, I was told to take an antihistamine to calm down the bladder, given hydroxyzine. I worry about this med causing dizziness. She said you could try Zyrtec. How do I feel about antihistamine therapy? Honey, I used hydroxyzine for about 8 years myself. What I liked about it is that it had a very mild, beneficial side effect. It helped to calm anxiety. And so I took hydroxyzine to help me get through the night. I was legit afraid to sleep because I had my worst pain at night. And I had somebody tell me late last week that they also suffered. They didn't want to go to sleep because they knew that their flare would hit in the middle of the night. And what typically we see is you just push back your time to go to sleep. So instead of going at 10, now you're trying to go to sleep at midnight. And then a couple months later, now it's 1 o'clock, and then it's 2 o'clock, and then it's 4 o'clock. And that's how I was for probably 5 years. I mean, probably from 1993 to maybe 2000, because we didn't know about physical therapy back then. And I'm a pelvic floor patient, and I was just doing bladder treatments and not getting better. And so sleeping became very, very difficult. We do have over on the IC network, I did bring in a couple of new sleep aids, a melatonin and a melatonin-free sleep aid called Rest ZZZ. And so quite a few patients are trying those now to see if that will help them sleep. Just remember that nighttime pain is usually a direct reflection of what you've eaten that day. So if you're having that 1 cup of coffee and you're up all night, we got to suspect the coffee. If you're, doing something funky during the day, you pay the price usually in the middle of the night. Queller says, you continue to work under stressful conditions. This caused a flare-up that I cannot get under control. All right, let's look at what I say for stress flare. So hold on a sec. Let me find it. I've got the pudendal neuralgia flare. I've got the stress flare. Okay. Everybody who's watching this, and just know that, while we do it live, we're probably going to have 40, 45 people, but usually by the end of the week, 3,000 to 5,000 people have watched this meeting. So I'm just going to speak to pretty much everybody in this meeting because pretty much everybody has had a stress flare. Okay. So let me just read this a little bit. Almost every patient has experienced or is vulnerable to a stress-induced flare. When we are under intense and or constant stress, our body prepares itself to fight, flee, or freeze. This has kept humanity alive for thousands of years, especially when we feared a saber-toothed tiger walking by. Today, our days are filled with different but equally powerful types of stress. From financial insecurity to social media, this stress triggers a physical response, such as increased blood pressure, increased heart rate, tighter muscles. And during periods of intense stress, pelvic floor muscles often get tighter and nerves get more sensitive and painful. Persistent stress, anxiety, and fight or flight amplify pain throughout the entire body and drives other painful conditions that many patients struggle with, such as IBS, vulvodynia, TMJ, etc. So what are our triggers? of a stress flare? Well, just stress, conflict at home, difficult at work, adverse childhood events, especially if you grew up, say, with an alcoholic parent or a violent parent. Caffeine, foods that contain caffeine are neurostimulatory and act to intensify symptoms. Chemical exposures, restricted restroom access. Hey, man, there's a thing. You tell any IC patient they can't use the restroom, that's going to trigger a stress flare. Or in your situation where you're denied access to a restroom, like on a plane when it's taking off, you're going to have a stress flare. And so we have a rescue plan. How do we calm that central nervous system down? Number one, breathing, deep breathing. We want to use the 4-7-8 breathing technique, which will immediately take that brain out of fight or flight. And so what you do is you breathe in for 4, you hold for 7, and you breathe out for 8. Thank you, Christy. Yes, that's Dick's Sporting Store. Okay, let's do it. We're going to do a 4-7-8. So I want you to breathe in for 4, hold for 7, breathe out for 8. So do it with me. Let's breathe in for 4. Hold for 7. 1, 2, 3, 4, 5, 6, 7. Breathe out for 8. 1, 2, 3, 4, 5, 6, 7, 8. Let's do it again. Breathe in for 4. Hold for 7. 1, 2, 3, 4, 5, 6, 7. Breathe out for 8. Okay. Another technique you can use. This is just y'all gonna think I am freaking nuts, but this is proven. It's proven. You can make a sound if you purse your lips and do this. Okay. Oh my God. I'm going to embarrass myself. Believe it or not, that also resets your central nervous system. So try it with me. Go. Isn't that weird? It's so weird, but it works. Okay, what else are we going to do? Movement, gentle exercise. Man, get outside, get away from the stress, get out in the sunshine and walk. You can do reflexercise. So when you're standing, curl your toes into the ground as if you're gripping the surface. You're not running, you're anchored to the ground. Open your arms to the side with your palms facing out. Your hands are not clenched. They're relaxed and open. The front of your body is open. You're not hunched. You're not hunched over in any way. Then you turn your head from side to side. Okay. Close your eyes. Put your tongue between your teeth. Take 3 deep breaths. And then most importantly, think about something that makes you happy, something that you love. You can do the power pose. This is also proven. Do the Wonder Woman pose, the Superman pose, like this. Listen, if you're going to walk into a situation like a difficult family event or going to work with somebody who's just being a bitch, before you walk in, stand there, put your legs to the side, put your hands on your hips, shoulder back, head held high. And believe it or not, if you hold that position for 2 minutes, it increases your testosterone and your courage, while it also decreases the stress hormone cortisol. And even if you don't feel powerful, fake it. Anytime you have to walk into a situation where you might feel powerless, do the power pose beforehand. I love that. Anyway, we have a lot of other things in here too that you can do for stress flares. The I Spy technique, the bumblebee breathing, that's this one. That works. You can do tapping. We can go through some of these if you want to learn how to do them. I would be happy to show them to you. All right. Joanne says, I asked this previously. Unfortunately, now it costs too much due to the new export costs since Brexit. Yeah, we are all challenged right now with tariffs and with Brexit. And oh my God. And I just apologize to everybody out there for where we are right now. It's heartbreaking. Linda says, explain to me why lactoferrin seems to be helping me so much. Okay, so a year and a half ago, researchers in Europe, in Italy, I think at the one of the universities, University of Italy, I don't remember which branch, but they released a study that came out a week after I had my double mastectomy. And so I will never forget this study because I'm sitting here, I've got drains, I'm in agony, these are brutal surgery for me. And I'm occupying myself and I'm just going through IC research, trying to divert my attention. And I find this study that showed Hunner's lesions healing. So I looked at that study and it was an amazing study. And I thought, okay, I am not thinking clearly. We have never had anything show Hunner's lesions healing like that. So I thought it was my pain meds. So I put it to the side for 2 months, got myself, I only used pain meds for a couple of weeks. But anyway, got myself calm and better, not as traumatized by my surgery. And I went back and I looked at the research and it was stunning research. So what is lactoferrin? Lactoferrin is a protein that our body makes that is part of our immune system. It is one of the most important proteins found in colostrum, mother's milk. And remember, the purpose of mother's milk is to help build their baby's immune system. And that is why children that do not get colostrum seem to struggle more. And so it has a natural antiviral, antibacterial, antifungal effect. We make lactoferrin. Our body makes its own lactoferrin. So we have lactoferrin right now in our tears. We have our own human lactoferrin in our vaginal fluid. It's there. It is a normal part of our healthy immune system. Unfortunately, our ability to make lactoferrin can decline for any number of reasons, not sometimes just aging. And so researchers have been studying for many, many years now the use of lactoferrin derived from cows on humans and on adult human diseases. And that research has been incredibly encouraging. So about 4 years ago, this research team decided to try lactoferrin in patients who were struggling with recurring UTIs. Because the UTIs are brutal, recurring UTIs that come back over and over and over. Okay, Sherry, that's great. I can do that. Hold that thought. So recurring UTIs can be brutal. There are just some patients who every month, every 2 months, they get infections. And we have a lot of theories on that. And we also have some new research on that. These researchers in Italy said, well, let's see if we can boost our body's immune system so your body can fight off infection. And they did a study with lactoferrin and it worked. It found that patients who were struggling with recurring UTIs had far fewer UTIs after lactoferrin treatment. Then that same research team decided to study IC. And that study was very, very well done because they did cystoscopies before and after treatment. They documented the condition of the bladder wall before and after treatment. And they also measured inflammatory markers through blood testing, systemic inflammation. So these patients took lactoferrin for roughly 5 to 6 months. And at the end of that period, 28 out of 31 patients were asymptomatic. They had no flares. Their red inflamed bladders became pink and healthy, and Hunner's lesions virtually disappeared. They could barely see them because they had the maps of the bladders before. And then for the other 3 patients, those patients had 1 flare. So that study concluded that lactoferrin Oh, and also systemic inflammation in all patients through blood testing also dropped way down. So that was a very, very exciting. And so lactoferrin is what I would consider a next generation supplement. Absolutely worth trying, especially in patients with Hunner's lesions, but really for anybody struggling with what they might, if they believe they have recurring UTI, if they're confirmed UTI. I mean, listen, I'm not a doctor. I can't give you medical advice. It's never my place to get in between you and your doctor. But if we want to try to boost your immune system, the lactoferrin would be an interesting experiment, but it's not a treatment for an active infection. If you've got active infection, you have to work with your doctor correctly to get the right treatment. There is a blog on the front page of the IC Network website that goes into it. It goes into it, gives all the research. You can go look at that research. It's very exciting. And there's even really good research with lactoferrin in cancer now, too. So, yeah. Hey, Allison, feel free to give me a phone call. I get calls from the UK all the time. The hardest part is just the time difference. I'm in Pacific Standard Time. You look at the time clock. If you can call me anytime after 10 a.m. Pacific time, let's brainstorm. And I will go ahead and look at all the new stuff on Amazon UK and see if I can refer you to something. Hi, David. Linda, there's two different PEA products. There's PEA 500, also known as Peora. It's right on the front page of the IC Network shop. This is what I take. And then there's P-Leaf. This is made by the company that makes Pre-Leaf. So they created a similar name for PEA, but it doesn't do what Pre-Leaf does. It's not about food. This is about calming nerves down. You can get this on Amazon. And it's on sale for 30% off right now. Dia says, that's the same in Canada. No, we ship to Canada every day, honey. We can ship to Canada, no problem at all. It's just, I mean, right now, if you don't mind me swearing, I'm just going to say right now that the U.S. Postal Service and the Canadian Postal Service are both kind of screwed up. I wanted to say another word instead of screwed. So buying anything for the cheapest first class, a lot of packages are getting lost now. A lot. In fact, I sent somebody a check for several $1,000s. It got referred back to me, which is amazing. And the address was correct. I mailed to them all the time, and it just got sent back to me for like no reason. So if you're up in Canada, it's worth paying for Priority International. It is a little bit more expensive. I will tell you what a lot of my Canadian customers do is they get together in groups, and if you're within 100 miles of the American border, and I know coming over to America sucks right now, and I apologize sincerely for the chaos that's going on right now. One way to reduce that cost, if you're willing to do it, is just get a U.S. post office box at the nearest town. And then we can ship there, and then you can just come down, once every 2 weeks, or just rotate whoever's in your group. That's a very, very common. Okay, Sherry would like to see tapping. So let's do tapping. Okay, so we're talking about calming the central nervous system down. So this is an acupressure method that turns off the amygdala. It turns off the stress response. You have to remember that stress is really driven by your brainstem, the most primitive part of your brain. And it has one job: to save your life. So what your brainstem does is it monitors all of your sensory input. What do you see? What do you hear? What do you smell? What are you tasting? And what are you touching? And if it senses a threat, if you hear somebody screaming, or you hear a siren, or you see something scary, it's going to take charge of your brain. It's the sympathetic nervous system takes control of the brain. It turns on a structure called the amygdala, which is the command and control center for fight or flight. And then you're in fight or flight until the stressor is gone. And then when the stressor is gone, the parasympathetic nervous system is supposed to take back control of the brain and calm everything down. But that doesn't happen for a lot of us, especially if you grew up with childhood trauma, where your brain was trained into a stress response because you lived with somebody who was scaring you, or it's a trauma response. So the language of fight or flight is sensory input. So what we're going to do is we're going to use sensory input to turn it off. And this is called tapping. And what we're going to do is we're going to touch different parts of our body and tap it. And we're going to force that brainstem to focus on that. So, okay. Now, a lot of times, so this technique has been tested with combat veterans, people who come back with PTSD, and within 1 month, their stress levels drop dramatically. And some no longer have PTSD doing simple nerve calming effects like this. So there's basically 4 steps to it. Number 1, you can ask yourself, what pain do I want to work on? So let's just say we're going to work on bladder or pelvic pain. And then I want you to rate your pain on a scale of 1 to 10, with the 10 being the worst, 1 being the best. Okay? So bladder pain, pelvic pain, rate your pain on a scale of 1 to 10. And then it's sometimes helpful. Some people like to do this and some people don't like to do this. It's helpful to have an affirmation that you can say to yourself while you're doing this. Like, I can do all things. I can do this. Let's just say, I can do this. I will do this. I am strong. I am capable. I will do this. Okay, so what we're going to do now, so again, we're doing bladder pain. We're rating our pain on a scale of 1 to 10, and we're always going to be saying to ourselves, I can do this. I'm strong. I can do this. Okay, so we're going to start here. We're going to do a karate chop on the side of your hand. And we're going to do this 7 times. So 1, 2, 3, 4, 5, 6, 7. And let's do it one more time. 1, 2, 3, 4, 5, 6, 7. Take a quick deep breath in. Deep breath out. I can do this. I'm strong. Okay. Now we're going to do between the eyebrows 7 times. 1, 2, 3, 4, 5, 6, 7. Let's do it in because we're getting it. We're focusing on the brainstem. It's paying attention. 1, 2, 3, 4, 5, 6, 7. I can do this. I am a strong bitch. Okay. Now we're going to move to the side of your eyes. We're not doing the temples. We're doing this bone right here. Same thing. 1, 2, 3, 4, 5, 6, 7. Let's do it again. 1, 2, 3, 4, 5, 6, 7. I can do this. Man, I am so much stronger than I realized I was. We got this. Okay, now we're going to go to the top of the cheeks right here. 1, 2, 3, 4, 5, 6, 7. 1, 2, 3, 4, 5, 6, 7. We got this. We're tough. We can do this. Okay, now we're going to go under the nose, right here. 1, 2, 3, 4, 5, 6, 7. 1, 2, 3, 4, 5, 6, 7. I'm tough. You're tough. We're going to get through this together. Let's just do another deep breath in and out. Okay. Now we're going to go right here under the mouth. 1, 2, 3, 4, 5, 6, 7. 1, 2, 3, 4, 5, 6, 7. I'm strong. I'm so much stronger than people realize. I got this. Deep breath in. Deep breath out. Okay, now we're going to go an inch underneath the collarbone. And of course, you can't see my collarbones. They're right there. So let's just go right here. 1, 2, 3, 4, 5, 6, 7. 1, 2, 3, 4, 5, 6, 7. You know, and again, your brainstem's going, oh, this is unusual, but it's not a threat. Everything's okay here. And you're really making your brain work. It's calming. Okay. Okay, then we're going to go to the armpit at the bra line. Here, I'll just do this side. 1, 2, 3, 4, 5, 6, 7. 1, 2, 3, 4, 5, 6, 7. I am strong. You are strong. We are going to exceed where other people tell us we're not. We're going to prove to them that we are strong. We got this. I will do whatever I need to do to help get this under control. Okay, deep breath in. Deep breath out. Okay, last but not least, you got to tap the top of your head. 1, 2, not hard. 1, 2, 3, 4, 5, 6, 7. 1, 2, 3, 4, 5, 6, 7. Whew. Wow. I'm a tough cookie. Use that information. Deep breath in. Deep breath out. Okay. How do you feel? How do you feel? The best example I can give you, because when mine was at my worst in my 30s, you know, and one of the things that we see, and I see patients who have widespread pain, and this is one of my phenotypes, is anxiety disorder. And my anxiety disorder goes back to when I was a kid and I was attacked in 4th grade by a rapist murderer. Yeah. I didn't leave my house without fear for a decade. And that created a foundation of anxiety for me that I suffered with. I was in fight or flight from 4th grade all the way until the age of 35. And when I finally learned how to turn off fight or flight, wow, it's amazing how much things got better. But here's one of the things that I learned back then. If I found something weird on my body, or I was experiencing a weird symptom, I would catastrophize and worry about it. Hey, what's that bump? Is it skin cancer? Oh my God, look at that. It looks like it's getting a little bit bigger. I could do that for months. I could literally do that for months. Instead of freaking just calling the doctor and going and getting checked, I would allow myself to worry unnecessarily for a long time because I was kind of afraid to go to the doctor. And so then when you finally call the doctor, you know, it's an act of desperation. I feel so awful. I have no choice. I have to go to the doctor. And driving to the doctor, lots of anxiety, lots of panic, and the pain is off the charts. Like, oh my God, I must be dying. You know, but you get yourself there, but it's not fun to get there, but you get yourself there. And then the doctor goes, Jill, that's not cancer. You're fine. That's just a little sunspot. Why didn't you come in a couple months ago? I can't tell you how many times I realized that I had wasted precious time and energy worrying about things that there was no reason to worry about it. And my rule now is if I ever see anything or experience anything that scares me, man, I just call the doctor and go. I am not going to allow myself to sit there and worry for days, weeks, or months. I'm going to go do it. And that's my policy. And I will do that with the ER too. Like if there's something like I get, I've had AFib twice. So my heart gets funky. I'm not going to sit at home. Unlike somebody I know who might be listening to this, who sat at home with severe tachycardia for 24 hours before calling for help. My God, woman, what the hell are you thinking? It's like, no, listen, if I'm in tachycardia for an hour and my breathing is not working and my meds are not working, I'm just going to get in the car and drive to the ER, even if it's 3 a.m. I know that it's pointless to sit and worry and waste. Kelly says, I was diagnosed with a UTI last week. The pain was unbearable. Just finished up antibiotics. I will ask my urogyne about lactoferrin and my follow-up appointment on Thursday. So Kelly, look at the research. So if you go over to the IC Network website, right on the front page, there's a blog on lactoferrin that has the link to the UTI study so that you can print out that study and bring it with you. And just understand that, you know, you're kind of damned if you do and damned if you don't with antibiotics. I mean, if you've got a really severe infection, you have no choice. You have to take the antibiotics because we don't want that infection to spread up to your kidneys and develop a kidney infection, which would be horrific, right? Because that could be fatal. And so anytime we're dealing with a severe infection, my God, we absolutely want to treat it. And antibiotics is a way to do that. But then the second half of that question is why are you vulnerable to infection in the first place? That's the most important question to talk to your doctor about, especially if you're having multiple infections. Number one, it could just be estrogen atrophy. If you're just getting older, your body can't make the mucus it needs to protect the tissue. That makes it harder for the bacteria to get to the cells, to infect the cells. So estrogen atrophy is a real strong risk for recurring infection. Sometimes, too, it's your immune system. You might have an immune system that's struggling. And so if you've had a lot of infections, having your immunoglobulin Gs tested would be a perfectly reasonable thing to do. Let's just make sure your immune system is strong and healthy. And also understand, too, that quite a few infections are now coming from food. We all get that inevitable lecture of, Jill, are you wiping from front to back? And it's like, woman, do you know how offensive it is for a doctor to ask me that? I am 65 freaking years old. I learned how to wipe myself when I was 5 years old. I do not wipe from back to front. I am smarter than that. And there is this assumption that the reason why women get infections is because they're not wiping correctly. And that's a load of you know what. The newer reason why people are getting infections is because it's coming in the food we're eating, specifically the meat. We've had bladder infections come from chicken, from pork, and from beef. And some of the most severe drug-resistant infections are coming from meat sources. So that would be the other thing I would suggest is we're just cleaning up your meat. Buying from local butchers rather than from factory farms. And I wouldn't touch fast food with a 10-foot pole because you don't know where that beef patties come from. Allison said, who would oh, there you go. She's asking if somebody would help her with the bladder builder. You guys message Allison. Rebecca says, can you take more than one PEA in a day? Yes, you can. But Rebecca says she's been flaring for 2 weeks super bad. Girl, we got to figure out the type of flare you're having. I mean, is it a bladder wall flare? Is it a pelvic floor flare? Is it a stress flare? Is it a hormone flare? Or is there any chance that it's a UTI? Listen, if it's a super, super, super bad flare, you should have a home UTI dipstick test your urine and let's see if there's any chance that you've got an infection. Because sometimes your flare can actually be infection. So you can buy dipsticks. So Azo, you can buy Azo test strips at CVS, or you can buy the generic test strips from Walgreens. And, just hold it between your legs while you're peeing, get it wet, set it to the side for 15 minutes, and let's see what we find. If you are, here we go. So these test strips typically have two test pads. The top one is for leukocytes. The bottom one is for nitrites. Okay, so leukocytes are white blood cells. Nitrites are made specifically by bacteria. So if you have a double positive, they're both purple, you absolutely have infection. Absolutely. Because this only comes from bacteria. I mean, bad bacteria. So what you do is you can take a copy of your test strip, email it to your doctor. Hey, I've got an infection. Here's what my test strip looks like. And see if they can order a urine culture for you. If, on the other hand, you only have this one, or you have this, or you have this positive leukocyte, but you're not positive nitrite, that often happens just with a bladder wall flare. That just means your bladder wall is really irritated. So what you do is you might sit on that for a day or two and then test it again. But here's my rule. Number one, if you're in so much pain, you're scared, get your ass to the doctor. Don't wait. Go to urgent care. Go to the ER. If you see blood in your urine, do not wait. Get there quickly. That is not normal. So Kelly said here, thanks, Jill. I thought I was in a never-ending flare. She went to urgent care, ended up with a UTI, and you're going to get the next generation urine test. Okay. If you're scared, if you are suffering, if you are in agony, don't tough it out. Go get checked, especially if you've got blood in your urine. No reason to stay at home. Get there if you can afford it. Oh, don't even get me started. Okay. Oh, it's a whole nother conversation. Melissa says, I've been using estrogen cream 3 times a week, but you're still getting UTIs. Okay, so Melissa, I would want to know the health of your immune system. Just had a hydrodistension with cystoscopy, and I think I did take wondering why. Okay, I don't know what that means. Linda said, I'm using Silky Peach on alternate nights. Seems to be helping me a lot. Silky Peach is that peach tea. Isn't that the peach tea that people are selling that's like $38-40? And it's basically chamomile herbal tea, guys. It's chamomile with some mint and some peach leaves and something else in it. I don't think you need to buy that peach tea, but I mean, I happen to really like peach tea, but I'm not going to pay $40 for a tea. If you look at the ingredients, it's chamomile, and chamomile and mint. We already know that's the most effective combination for flares. So, just making yourself a strong cup of chamomile or peppermint tea will do the job too. But girl, if you like it, go for it. Johanna said, I would like to speak to my doctor about stopping amitriptyline. Is there anything you would recommend instead of this medication? For frequency urgency, it would be Myrbetriq, Myrbetriq. Joan says, I get chronic UTI and Hyprex has helped. I was getting UTI twice a month, have not had one for 4 months. Excellent. Good to hear. Millie said, I found what I thought IC was actually Ehlers-Danlos syndrome. Yes. And is it this article? Hold on. What article was it? No, it was the phenotyping. Here, hold on a sec. So we had new study. Let me see if I can find it here in my pile of interesting papers that I need to file. There was a new phenotyping study in which they believe that ligament laxity, Ehlers-Danlos, is a phenotype of IC. I don't know where that paper is, but I know I went through it a couple weeks ago. All right, let's keep going here. Oh. Tanya says she's got to go. It's almost 6 in Florida. Yeah, you go have dinner, honey. Rebecca said, I went to the doctor. They said it's not a UTI. It's bladder wall and estrogen. I just had my estrogen tested Friday. No results yet. You know, Rebecca, you don't really need tests for estrogen atrophy. They just need to look at your skin. Estrogen atrophy is very, very visible. The skin gets thin and it develops kind of lines in it that you can't see, but the doctor could recognize. So, you know, I don't put a lot into estrogen blood testing. To me, it's all, the proof is in the quality and health of the skin. And just remember, if your vulva is dry and your vagina is dry, then so is your urethra and so is your bladder. And that is a legit phenotype of IC known as genitourinary syndrome of menopause or estrogen atrophy. Johanna says she's taking Myrbetriq too. Excellent. So the reason why this is important, guys, is that the early treatments for IC focused on amitriptyline, also known as Elavil, and hydroxyzine, also known as Atarax or Vistaril, and Elmiron. And the other thing that they would often recommend is ditropan, oxybutynin, and or Detrol. The problem is that the ditropan, the Detrol, the amitriptyline, and the hydroxyzine, those are all anticholinergic medications. And anticholinergic medications have now been linked to cognitive decline and dementia. That if you take them every day for 3 years, it increases your risk of dementia by like 50%. And hey, man, I took amitriptyline for 8 years. So I don't believe that I'm having cognitive decline at all, but I would never do that again. And the general rule now is that if you're, well, understand, number one, that it's the totality of it. You know, taking one small dose of one might not be as risky, but if you're taking 3 or 4 medications that are all anticholinergics, understand that some over-the-counter products are also anticholinergic. Before you know it, we have a really high burden, an intake of anticholinergic medications that could substantially increase your risk of cognitive decline. So, number one, if you're over the age of 60, they don't recommend giving you any anticholinergic medication because we are trying to maintain your cognition. And so, and we were talking about this a little bit earlier, you know, doctors often just try to give you something just to get you out of the office. And so it's very common for them to give you oxybutynin or to give you amitriptyline, both of which are strong risk factors for this. So it's important that you not just say, okay, I'll take anything. You have to do your research first. And now that you've listened to me say this, you're going to say, Doc, I don't really want an anticholinergic medication because I want to maintain my cognition. We already have a risk of dementia in our family. I don't want to increase my risk, which I had a patient say to me last week. And you're going to do the same thing with Elmiron. It's like, doctor, listen, I don't want to risk damaging my eyes or damaging my bowel. So I want to try other safer medications before you would give me a medications that have a stronger risk of serious adverse events. And so Sherry says you're on amitriptyline right now for several years. Yeah. I mean, you can Google this. This is called anticholinergic. Let me just spell it out for you. Here, that's a question on YouTube. So anticholinergic medications should be avoided if you are over the age of 60, or at least, and sometimes multiple doctors will each prescribe you an anticholinergic, but they don't realize you're taking other anticholinergics. So then it's your pharmacist that goes, wow, you're taking a lot of this. This might not be a good thing. Maybe you need to go back to your doctor and look for other options. Amitriptyline for me, Sherry, I will tell you, irreversibly changed my heart. Amitriptyline is known for, let me get it, changing, oh, come on, what's the exact word for it? It changes heart rhythm. It changes nerve function in the heart and heart rhythm. And so when I took amitriptyline, I only took it for 3 months, and I started getting tachycardia, so a very rapid heart rate. And then I was getting a like a really hard heartbeat, which was a preventricular contraction. And so my heart just got really, really scary and really, really bonky. And I ended up at the ER with my heart doing crazy things. And I was referred to the cardiologist, who then they did all the heart tests. And what amitriptyline did is it activated a third node in my heart. So normally you've got the AV node and the SA node. And so your heart rate is beep, 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 beep. That's a normal heart rate. Beep, 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 beep. My heart rate was beep, 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 or it was beep, beep, because 2 nodes would go off at the same time. I wore a heart monitor for a month. I remember, because I was so scared, I was making dolls. I just, and this very room that I'm sitting in now, before I turned it to my office, was a bedroom with a sewing machine. And I would just sit here and I was just designing and making stuffed animals, stuffed dolls. I just needed to do something that would give me comfort, because this was way before I started the IC network. And I still have it. I mean, it's fine. It's calmed down substantially, but I take heart medicine every day. And then I got COVID tachycardia, which worked it all up again and put me into AFib. So if I could go back, and any medication that I took that I would never take again, it would be amitriptyline. If you're prone to tachycardia when you take Benadryl, then do not take amitriptyline without talking with your doctor, because it can really mess your heart rhythm up. They were addressing, wait. She says, I have tachycardia also. Well, welcome to the club, my friend. And this is not a good club. You need to talk to your doctor about that. That's not good. That is not good. And especially if you start getting irregular heart rates. So might not be the medication for you. You need to have a conversation with your doctor about that, okay? Isn't that freaky? All right. Let me go back to Facebook here. Katie said, what's my thoughts on E-string? E-string is another way of delivering estrogen into the vaginal wall. It is a little round, kind of a thick round donut coated with medication that's time release that you put up into your vagina. and it will stay there for like 2 weeks, and then you take it out, and you put another one in. If you can keep it in your body, power to you. I tried it. It just kept falling out. So, estrogen creams, I think, are better because you have better ways. You have more flexibility on how you apply it. So if, for example, you're having urethral pain, you can put your estrogen cream right on the entrance to your urethra. You can put it on your vagina. I mean, on your vulva. And so, yeah, I understand. It's just difficult to keep in. At least I just couldn't keep it in. It just popped out of my body every single time I tried. So I gave up. I mean, and I remember one time it fell out in the toilet, and it's like, oh, hell no, I'm not putting that back in my body. Rebecca said, I'm trying to get in for an installation, but they still haven't called me back. They switched my estrogen from a cream to a patch. Might not be working. That's weird. I mean, if we're just trying to improve your skin health down there, we wouldn't be doing a patch. We'd be doing a cream where you can put the estrogen right on the cream. So that's an unusual decision, but maybe your doctor had another plan for that. Sandra said, I have incontinence with IC, looking for something to help with this. So, Sandra, incontinence often points it usually points directly to muscles and nerves. And so, are we dealing with very, very weak muscles, or are we dealing with nerves that aren't working correctly? So, one of the things that happens with menopause, starting with perimenopause, is you might notice that when you pee, you think you're done, and then you stand up and you go, whoops, not done. You sit back right down on the toilet, a couple more drops come out, or a little bit more comes out. You go, okay, I'm done now. You stand up. Nope, still not done. You sit back down. There's more there. I call that milking the bladder, and that is an example of estrogen loss affecting muscle behavior. At least that's what I've been told. I have only wet my pants twice as an adult. The last time when a dog charged me and I fell on my butt and I just let it go. I just let it go. So embarrassing. But stress incontinence is often also happens as we get a little bit older. So what is the health of your pelvic floor? What is the health of your nervous system? And what is the health of your skin? If you have weak muscles, this is where Kegels would apply. We don't do Kegels for tight muscles. We do Kegels for weak muscles. And so it would be reasonable to go have a pelvic floor assessment, and let's see how healthy your muscles are. The doctor can test your nerves a little bit more with a urodynamics test to try to see if maybe we're dealing with nerves that are being a little dysfunctional. Sometimes it can come from a compressed nerve at the spine around L4, L5. If you have a ruptured disc in your back and you suddenly become incontinent stool incontinent, fecal incontinence, or urinary incontinence, that actually is an emergency. That's a very, very specific type of nerve injury, and you are to go immediately to the ER, because the sooner they fix that disc from compressing that nerve, the more chance we're going to regain normal function for your bladder and your bowel. So if this is very, very sudden or it's combined with fecal incontinence, we got to check. We've got to check the health of your nervous system too. Make sure there's no injuries going on there. Isabel says, I was on Elavil 10 milligrams for 12 years, helped me to stay working. But once I heard about the cognitive issues, it took me about 6 months to titrate myself off of it. Yeah, the other hard problem with Elavil and medications like that is The most effective dose is basically 75 milligrams, but every doctor admits getting a patient to be able to tolerate 75 milligrams is very, very difficult because the side effects are real. Dry mouth, dry eyes, weight gain, heart issues. And so you kind of got two schools of thought. School of thought number one is lowest effective dose with the least amount of medication you can take that doesn't give you side effects, but will still help your nervous system, which for me, I took 10 milligrams of amitriptyline. I never got higher than that. And my heart just got messed up so badly, even from 10 milligrams. Yeah. It's a hard medicine to tolerate. I don't remember having trouble. Well, I took so little, it was very easy for me to get off of it. Sounds like you were taking more. Maybe you were up at 50 or 75 milligrams. So titrating off of it slowly makes sense. There are some other medications that also have problems. We call it a discontinuation syndrome. And a good example of a medication that's very difficult to get off of is Cymbalta. Cymbalta discontinuation syndrome is real. And that's because when we're getting off meds, we reduce the dose gradually, right? If we can so let's say you're taking 50, then the ideal thing would be to go to 40 and then 30 and then 20 and 10, if you can make that work. But some medications, you can't do that. Like you're at 50 and then you're at 0. And how do you get from the 50 to the 0 if you can't cut the medication in half? So some discontinuation syndromes can have a patient hallucinate for 6 months. And Cymbalta is one of the brutal ones. Ah, Sherry, no. Girl, I am like your nightmare today. So Sherry is on amitriptyline and Cymbalta. Yikes. So you cannot cold turkey Cymbalta. You cannot do that. So you are going to have, yeah, I know. I'm sorry, hon. But at least you're knowledgeable and informed, and at least you're not going to try. If you tried to cold turkey it and you started hallucinating, you'd know why. But we just don't want you to do that. And in the end, I mean, Sherry, listen, here's the deal. I see it's a pelvic pain syndrome. And the medications you're on are about controlling symptoms, but they're not going to fix anything. And we need to understand what's driving these symptoms in the first place so that you can work on that. Because if we can fix the underlying cause, then you wouldn't need all those medications, which I call chasing the symptoms. Chasing the symptoms makes the drug companies a lot of money, makes supplement companies a lot of money, but it won't get you where you need to go. Listen, if you're on a therapy and you're still flaring, at what point are you going to say, maybe this medication isn't helping me as much as I thought it was? Our national guidelines say if you're not responding to treatment, if you're getting worse rather than better, take a step back, revisit the diagnosis, and we have to ask ourselves, what could we have missed? And what we consistently see are patients who have never had a pelvic floor exam, who are very clearly pelvic driven, who need to be in physical therapy. That the Cymbalta and the antidepressant will never fix the underlying problem. And we have to fix the underlying problem, which is tight ischemic pelvic floor muscle. Tight pelvic floor muscles leading to pelvic ischemia or ischemia. What does that mean? That means the muscles are so tight, it's now restricting blood supply. That's not good. If your bladder is supposed to get 24 units of blood a day and it's only getting 10, are you going to have a healthy bladder? Of course not. Of course not. There's no way. If your bladder is not getting enough nutrition and oxygen, it's not going to be healthy. Our therapeutic priority with pelvic floor patients is to restore blood supply. That's why we do physical therapy. We got to relax the muscles to get the blood flowing again, because when your bladder gets the blood flowing again, it's going to heal more. Manko says, hi, Jill. I'm very sensitive to hormone replacement therapy whether it's Vagifem or cream. There's no topical HRT available in the United Kingdom. Please advise. Thank you. Well, you're in a pickle, hun. We've certainly worked with a lot of patients, and in fact, 2 last week or in the last 2 weeks, who get breast tenderness and with their topical estrogen cream, and I think one had another symptom in there. I don't remember what it was. There are some patients who may not be able to tolerate estrogen, and if that's the case, then you're between a rock and a hard place. So if you're having vulvar symptoms, then you're going to be using something like this. I always have it by my computer because I demonstrate it all the time. Vulva Balm. This is gold. This is so good. So this mimics your own natural mucus, and it is an organic. It's an organic olive oil, avocado oil, and sea buckthorn oil. It is a very, very, very light oil that mimics normal mucus. So you can use this on your skin, on your vulva, and everything down there every day. So protecting the skin this way would be a very, very good thing to do. You could use coconut oil. The problem with coconut oil is it's very messy, and it will soak through everything, and eventually it will soak through your dress or through your pants, and it'll make it look like you had an accident, as it did with me. Vagifem is not nearly Vulva Balm is not nearly as messy. And then to protect your bladder, if we're dealing with a lot of estrogen atrophy in your bladder, then you're going to be really looking at something like Bladder Builder, a chondroitin-based supplement that's going to help coat and protect your bladder. So Bladder Builder, Bladder Rest, Cystomend, or Cystoprotect. But this is the one that I personally believe it's the best one out there. Why? Because it has the ingredients to support the bladder wall, but it also has PEA in it to calm the nerves down. And we did a 1-year follow-up study. 60% of the patients who used it still use it. They love it. They reported fewer flares, less painful flares, and some were completely pain-free with Bladder Builder. The 40% who didn't, number one, they either couldn't afford it, or number two, their doctor wanted them to try something else. And also, any of the chondroitin-based supplements have the potential of causing a little stomach upset. So we always say, you take it with food. Don't take it on an empty stomach before you go to bed, and start slow, like 1 capsule for several days. See how you do. You can go up to 2 if you want. You can go up to 3 if you want. You can go up to 4 if you want. But I am not at the school of more is better. I think it's about finding the right dose that works for you. And I will tell you that many patients just take 2. And then the 62 bottle becomes 62 a month if you were taking 4, becomes $31 a month if you're taking 2. And that's a great way to save money. And God knows right now, everybody's trying to save money. Some patients, I had somebody call who she's on Social Security, and she said, Jill, it works so well for me. I just can't afford it. And I said, how many are you taking a day? She said 3. I said, go to 1. Then 1 bottle will last you 4 months. And she went, oh, hadn't thought about that. All right. Hello, Sherry. Long time no see. Katie says, doesn't the E-string help IC? Well, it's only going to help patients whose IC is being driven by estrogen atrophy. Not going to help the pelvic floor patient. It's not going to help the Hunner's lesion patient. It's just for those of us where we're just getting older and we just don't have good estrogen levels that are supporting skin health. That's who it's going to help. I'm glad yours stays in. Mine didn't. Mine just popped right out. It's the craziest thing. And the thing is like, I wasn't in a relationship. It's not like I was having a lot of sex. I just popped out. Sherry said, Eleva was the only med that ever helped my IC other than pain meds. I wish I could have continued it, but I ran out during the weekend and I experienced heart rhythm issues on withdrawal. Yikes, girl. I'm telling you. That's really, it's interesting that you had the heart rhythm issues on withdrawal. Our bodies are just so unpredictable. All right. So, what am I working on right now? I am okay. So I met my benchmarks last week because I'm pretty much working 7 days a week right now. Okay. So I've hired somebody to copy our forum. I did that yesterday. So our forum is shutting down for sure, 100%. It'll be gone in 2 weeks. We are outlining our next spring IC Optimist. We are moving our e-commerce platform. We're doing a lot of testing for that. I'm doing a lot of testing and setting up. I've set up a WooCommerce shop. I've set up a Shopify shop. Oh, it's a royal pain in the you know what. I am creating a patient registry for IC patients for Elmeron. And when I started off this meeting, I started off with a rant. We are really trying to create data so that we can get that black box warning adjusted to start talking about the bowel issues. So I'm asking anybody who has taken Elmeron, who's had any bowel issues at all, diarrhea, constipation, or God forbid, polyps on colonoscopy, or if you've had a colectomy because you've had carpet polyps, to please file with the MedWatch system. We've got to start developing that data. Now, I will be doing a new patient registry. It's already mapped out. I just got to enter it. And I've already sent it off to some of the top researchers. So everybody's in agreement. We need to do this next. So that is the next step for Elmeron. All righty. So in this coming week, more e-commerce testing as always. The IC 101 books are going to be up on Amazon soon. So you'll find the Flare Guide on Amazon, and you'll find the new Diet Guide on Amazon. Then the Kindles hopefully will be done within the next month. We will put those up. What else? I am working on a new medical records kit, and I am working on a new book for GSM, and I'm working on a new book for chemocystitis and ketamine cystitis. So I'm a busy girl, but the thing is I love my work. So, and as always, happy to take any phone calls from patients too. Oh, and got the taxes done. Oh, brutal. Hey, good news. I was paying, just you guys, for my health insurance, I was paying $1,800 a month. And that's now down to $250 a month because I'm on Medicare. I was like, okay, that's good. We're going to save $20,000 next year. Yeah, baby. I don't like getting older. I was talking to somebody who was 63, and I was like, aren't the 60s weird? They're so weird. It's like we feel so young inside, and yet our body is doing all sorts of weird things. It is. Cher said, I have night sweats and menopausal hot flashes that last for hours and hours. Also severe dry everything. What natural remedy or medicine is the safest? Stop with it. Well, estrogen, honey. Estrogen. You need to talk to your gynecologist about estrogen. And then for dry everything, nothing better than this, a vulva balm. It's right in the IC Network shop. We're now buying like 4 cases in a row. This just flies off the shelf, and it's so good. It's so good, and I use it. I mean, I use it whenever I feel dry down there. It's wonderful. You know the book here. Hold on a sec. Where is it? Here it is. Okay. The Menopause Manifesto by Dr. Jen Gunter is the modern version of that book, Our Bodies, Ourselves, that our mom all bought for us in the 80s and the 90s. And Dr. Jen Gunter is a pelvic pain specialist in San Francisco. She's actually a Kaiser doctor. She is fantastic to follow online. She's really outspoken. She doesn't speak for Kaiser. She speaks for herself. And she's somebody I admire greatly. So let's just see what she says. It would be helpful if I had my reading glasses, another thing of the 60s. Okay, estrogen therapy, she calls the first wave of menopause hormone therapy. I want to see what she says about supplements here. Hold on. She goes over the risks. She goes over the history. The main problems with menopause hormone therapy are blood clots. Yeah, I've worked with quite a few patients who cannot use estrogen because they have a history of blood clots. Breast cancer. Cholesterol. Oral estrogen can worsen triglycerides. Gallbladder. Oral estrogen can increase the risk of gallbladder disease. Heart health. Yeah. And stroke. Okay. But, okay. Hold on. Let me see if I can find. What does she say about, okay, she has a section on food. Humans don't get hormones from plants. We're not able to convert plant compounds into hormones. We make all our estrogen, testosterone, progesterone from cholesterol. That's interesting. Phytoestrogens are compounds found in plants that can mimic estrogen or interfere with estrogen. She says, are dietary phytoestrogens beneficial for people? So it's talking about soy phytoestrogens. So soy phytoestrogens did not show an increased risk of any negative health outcomes, such as increased thickness of the lining of the uterus, breast cancer, or uterine fibroids. Okay. So can dietary phytoestrogens improve the symptoms of menopause? While some people point to a lower rate of hot flashes among women in Japan who eat traditional Asian diet, very hard to sort out what benefit it is from phytoestrogens food versus the genetic ability to convert phytoestrogens into a more bioactive form, yada, yada, yada. Okay, bottom line, the best foods for hormone health are simply the best foods for health. Increasing dietary phytoestrogens is unlikely to help the symptoms of menopause. Milk is associated with an increased risk of breast cancer, but it seems unlikely that estrogen is the cause, as it's poorly absorbed by the GI tract. Okay. Okay, here, wait. Oh my God, this book is so long. She talks about compounded estrogen. Come on, give me the supplements. My God. What's it going to take? Here we go. Supplement, menoceutical, supplements in menopause. Okay, let me just go to the With the exception of omega-3 fatty acids and vitamin B12, the majority of supplements for otherwise healthy women who do not have nutritional deficiency have weak supporting data. And she says, avoid over-the-counter hormones. You know what? I would buy this book. And I mean, it's huge. Big discussions on all of this. You know, I was really hot yesterday. I mean, you guys, I've been kind of cranky. And I've been kind of cranky because my breast cancer incisions are so tender. And so I had steroid shots about 6 weeks ago. Made it worse. It made it worse. And now my nerves are really sensitive in my armpits, so I'm having trouble wearing shirts because I have a neuralgia from this. So I was wearing a shirt yesterday that was kind of long, and it was showing my incisions. See that? That's that side. See? And there's no cancer on this side, and yet look at that. Is that just not? See how? So annoying. So just bear with me. If you go back 18 months and you look at my meetings, you will see me doing this all the time. Hello, Danielle. Nice to see you, girl. I hope you're doing well. Thank you, Cher. I don't know. I went and saw the surgeon. She did the shots, and that's what caused all that redness on that side. It's weird. It's just so weird. Some days I just like, it's not sharp, agonizing pain. It's more like barbed wire pain. And so I just kind of, I just walk out of my office because working at the computer sometimes makes it worse, and pulling really makes it worse. I just kind of go, ugh, you know, I mean, it's so annoying. So bear with me here. It just is what it is. But this incision on this side, there's no cancer on my right side. Why does it hurt more? So annoying. All right, enough about me. All right, so we have been talking now for almost 3 hours, and I am happy to stay as long as you have questions. But once you're done, we can be done. Danielle is doing good. The lactoferrin and the PEA keeps the doctor away. Yeah, baby, love it. So, you know, what's the future of, I mean, this is something that I'm really being forced to face right now, is that everything has changed. You know, everything about how we work has changed. Everything about the internet has changed. Everything about supplements have changed. And so now old ways are called legacy, and they're often scoffed at by younger people. You know, a website is so legacy. Don't you have videos? It's like going to be really hard to educate you. It's going to be really hard to educate you with short, funny videos. I have our big video series called the IC 101 Masterclass. It's completely free. You can watch it right now on our YouTube channel, etc. Anyway, when we think about supplements, what's the future? The future, in my opinion, number one, the most important development is PEA by far, because there's so much research behind it. And again, I have a blog on it on the front page of the IC Network. There are dozens and dozens and dozens and dozens of studies with PEA with many different types of pain. And the safety profile is second to none. I mean, with most of those papers, the scientists going, wow, this was so well tolerated. We were really surprised. Very, very, very few side effects. And so I see PEA being the most important supplement in the future because it reduces pain and it calms nerves down. And then lactoferrin is, in my opinion, the second most important new supplement because that boosts the immune system. And that study showed a red inflamed bladder became pink and healthy. Now, a lot of people are going to say, well, don't you need more research? Well, number one, we already have a ton of research with both. There's a lot of research with both already. The question is do we have a lot of PEA-IC research or PEA lactoferrin research? And no, we've got one study. Well, we got two studies for the urinary tract for lactoferrin. And with the PEA, we've got studies with chronic prostatitis, chronic pelvic pain, interstitial cystitis, shingles. There might have been an IBS study in there. So I think that's the future. And for anybody who's dealing with a bladder wall permeability issue, whether it's from estrogen atrophy or a Hunner's lesion, it still is a chondroitin-based supplement, in my opinion. Is cranberry going to help? No. Is a UTI product going to help? No. And a lot of people call and they say, well, what should I take? And I say, well, I don't know. It depends upon your phenotype. We need to understand what your phenotype is. Because if you're pelvic floor driven, there's no reason for you to waste money doing a bladder wall supplement and vice versa. If you're pelvic floor driven, we need your money to go into physical therapy. If you've got pudendal neuralgia or widespread pain, then it's going to be PEA for sure. If you've got estrogen atrophy, it's going to be a chondroitin supplement. If you've got Hunner's lesions, it's going to be lactoferrin. If you've got a lot of bladder wall irritation, it would be lactoferrin as our first suggestion. Darla said here, I have bright red blood on tissue paper last Sunday. I've not had a Hunner's lesion in 4 years. Went to my urologist on Monday. No UTI, sent in my culture. It came back for group B strep. You're going to have surgery on April 23rd for a biopsy and Hunner's lesion. Good idea. I mean, that's a good idea, Darla. I mean, bright red blood is not normal. And I'm really proud of you that you went to the doctor. I think that's very, very important. And our job now is to try to understand where the blood is coming from. The blood could be coming from a Hunner's lesion. It could be coming from coming out of a ureter, from your kidney, from a kidney stone. So letting that doctor look is, in my opinion, a very wise move on your part. If you see more blood, if you see a lot of blood, get your tushy down to urgent care or the ER. I'm sorry, honey. I'm really sorry that you're going through that. That just sucks. It's just, and there are some doctors who will be like, well, it's just blood. We're not going to worry about it. But if you look at the newly updated IC guidelines that were released in 2022, there's now a really big section about doing a proper workup for patients who have blood in their urine. And that was something new that they added, that we just really want to make sure that we don't miss anything. So good. I'm really glad. And that's the other really weird thing is that sometimes, they found a UTI, you've got strep. So it could have just been that. Let's hope so. Let's hope it's just that. But you're uncomfortable. You're uncomfortable now. Are you on antibiotics for the strep? You say you had group B strep? So what antibiotic did they give you? Or are you on antibiotics? I would hope so. Yikes. Good. And are your symptoms getting better? Are you getting better or are you getting worse? If you feel like you're getting worse, call your doctor because they can switch it up perhaps to something else. Are you taking Keflex? Okay. I like Keflex, cephalexin. But it has fairly limited use. And for example, I had let me try to think. So I had a post-op infection in this incision. What did they put me on there? I always ask for Keflex because I always know it's going to be really easy on my bladder. And I did 3 rounds of antibiotics last year, which is really rare for me. I mean, I went 15 years without taking any antibiotic. And then they said, every time I asked for it, they said it's not strong enough for what you're dealing with. You get itchy with penicillin. I had okay, what did I do? Okay. I had pneumonia in December. We started with amoxicillin, didn't work. Then I went to Augmentin, it was about 30% better. And then we added Z-Pak. And it was a combination of the Augmentin and the Z-Pak, which finally killed my pneumonia from that damn super flu. Oh my God. So somebody's saying, what if you have microscopic blood in your urine always? I always have microscopic blood in my urine. Not really that big of a deal. Generally, if it's consistent and they don't understand why that's happening, they will do what's called a urine cytology test. A urine cytology is a very simple pee in a cup test that will look for cancer markers. And that's perfect. That would be something that they probably already done. They just didn't tell you about it because that's kind of protocol for when you see that. But that's something that you could ask for is a urine cytology test. Very easy to do, nothing to stress about. I've had it done a couple of times because I grew up in the home of a smoker, and my mom actually was smoking a cigarette while she was carrying me. My sweet mom that you guys all met, she was a hardcore smoker, because she was of that generation where they were told smoking was safe. And she smoked a pack or 2 a day all the way up until she was like 50. So Katie, number one, I wouldn't worry. You're not peeing bright red blood. Microscopic blood is very common. But if you're a smoker, if you have a history of secondhand smoke where you're exposed a lot, just say, hey, doc, can we do a urine cytology test? Let's just make sure this microscopic blood isn't linked to anything. Not a bad idea. Sherry says, what if your lab show trace of blood for... Listen, I've always had microscopic blood in my urine, going back to when I was a kid. I've never not had microscopic blood, and I'll tell you why. So okay. Where's my slide? Where did I put it? Here it is. Okay. So let me give you a little anatomy lecture to explain why that sometimes happens. So if urine gets to these cells, the urothelium is not a passive skin. It knows that when it senses a threat, it sends messages to your immune system help, 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 invader, 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 because urine is invading the skin. Okay, so the immune system, this whole immune system pathway gets triggered, and that then triggers a rush of leukocytes, white blood cells, which are your body's warriors. They swarm to the area, and they get to the area through blood vessels, right? So now these blood vessels, right in this area, the green things are nerves. So we're going to ignore the nerves. The blood vessels are these tubes. So now your body's warriors are sitting here in these tubes, your capillaries. Okay, but how do they get from here to here? Because the irritant, the infection's up here. The white blood cells are right here. So how does it get up there? The capillaries open and they release them. And when they release the white blood cells, they also release red blood cells. And that's exactly why when you have a bladder wall flare from drinking coffee or soda, you test your urine with a dipstick test, you could be positive leukocytes. It's just the way the body responds to superficial irritation of the bladder wall. And we have great pictures of infections actually burrowing into these cells. I can't show them. Well, I can't show them on YouTube because you're not connected to streaming software. I can show them on Facebook, but I can't do it. All righty. All right. So again, I'm here as long as you have questions. So we're slowing down a little bit. So what do you say? Are we done? Are we ready to keep going? If you give me questions, I will keep going. You tell me. I was going to talk, my original plan for today, and then I just pooped out, is I was going to talk about spring exercise, icy-friendly exercises. I'll probably do that next week. Oh, no. Wait a second. It's next week Easter, right? I got to look at the calendar. No. Next week is Palm Sunday. Easter is April 5th because I'm not going to be doing a meeting on Easter. I'm probably going to go up to my sister's house. We'll see. Dee said, I'm always concerned about the reliability of urine dipstick tests. What are your thoughts? The fundamental flaw with a dipstick test is that it will never identify anything. It is just a quick and easy way of trying to figure out if you might have an infection. It is capable of causing a false positive or a false negative, which is why, again, what is my rule? If you're scared, if you're in a lot of pain, there's no substitute for going to the doctor. You just go to the doctor, go to urgent care, let them check. But the home dipstick tests have always been reliable in my experience. I use them all the time with my elderly parents. I've used them many times when I've had flares because you feel like you have an infection, but really there's no infection. If you're having a flare and bam, you do a dipstick and you have no nitrite, then it's not infection, at least at that moment. But you can always retest. There are a lot of different types of dipsticks that are available now on Amazon. You can get the same dipsticks that doctors use. It's just data. It's good, meaningful data. And so I think it's important to have. I think it's number one, it's very affordable. Number two, on that Why flares hit on the weekend, I don't know, but they almost always hit on the weekend. So if it's Saturday afternoon and you're in a lot of pain and you just don't know, having a dipstick on hand just to see, I think is really, really meaningful. The far more important question really is, what is the reliability of urine culture? And that's really in doubt now. Urine cultures will only grow out the bacteria that feed on the medium they give. A urine culture is done with basically the equivalent of Jello. It's like a Jello source of nutrients that certain bacteria eat. So if you put bacteria on this and bacteria grow, then you can say, okay, I've got this type of bacteria. Urine cultures, though, are notorious for missing a lot of things because they will miss all the bacteria and certainly miss fungal and viral infections for sure. This is where next generation DNA urine testing really comes in handy. It's just jabbing me. I got this little spot. That's just bugging me. It's like right there. And there's nothing there. It's just like scar tissue and rib. Because when you have a mastectomy, they take all the fat, they take all the breast tissue, and they take the fascia. So it's literally my skin is over my ribs. Oh. So it's just like right there. It's like, oh, stop it. Just leave me alone. I have like a little gremlin in there that just bugs me every now and then. Tanya said, you're curious if azo is safe? I thought pyridium had issues. Well, they're both pyridiums. And pyridium, these are never meant for long-term use, ever, ever, ever. And there's been a lot of discussion and debate about what their safety. If you look at the labeling, I'm pretty sure the labeling says short-term use of a couple of days. We did have our first study last year, which found that the active ingredient, which is phenazopyridine, is now linked to the development of cancer in animals. And so we would never, ever recommend long-term azo, long-term pyridium for that reason. But taking it for a day or two for, pain from an infection, it's FDA, it's approved. The generic is approved. The medication is approved. I will say for me, I never had pain relief from pyridium or azo. I'd be in a wicked bladder, what I thought were bladder wall flares, never, ever touched the pain, made the pain better. And I can remember I was in San Diego with my sister, my mother, and my nephew. This was before I started the IC network, and I had this horrific flare. And everybody else went to Disney, and I was at home crying my eyes out. And I remember taking pyridium, and it did absolutely nothing for me. Nothing. And of course, now we know why, because I'm not a bladder wall patient. I'm a pelvic floor patient. I was having a pelvic floor flare from being on a plane and traveling. If I'd had a muscle relaxant back then, it probably would have stopped the flare in its tracks. But, and that's just a challenge. Is a lot of different things can cause frequency, urgency, pressure, pain, not just the bladder wall. Like muscles can do that. Fibroid tumors pushing on the bladder can do that. Pelvic congestion syndrome can do that. Compressed nerves can do that. Posterior fornix syndrome can do that. So it's so frustrating that it feels like infection, but it's not infection. And it feels like your bladder wall. But most of us, you have a cystoscopy, and when you wake up, it's like, well, Jill, your bladder looked perfectly fine. And you're like, how is that even possible? I am peeing every 15 minutes and I'm crying my eyes out all night long with bladder pain. How can I possibly have a normal bladder? And the answer is we have to look beyond the bladder. That's why when you call and I ask, I say, okay, have they looked in your bladder? It's like, yeah. What'd they find? Nothing. I went, great. That's good. That's great. That's good news. What that means then is we're not dealing with a bladder wall issue. We're dealing with something beyond the bladder, most likely. Usually muscles and nerves. But again, fibroids, pelvic congestion syndrome, all that sort of stuff. Cher says, I've got to cut back on the azo. I can hold the urine longer and it helps a point or two. Just yet for me on the severe side, it's been better than nothing. I mean, I think PEA is worth a shot. And I think for moments when you're having a really bad bladder wall flare, doing allopath. But again, it's not for the rest of your life. It's not for a month. It's just really until we can get that flare to ease up, something that will soothe the bladder wall and calm the nerves. You're going to try the PEA? Good. I think that's a really good idea. I love it. You know, I had horrible small fiber polyneuropathy. I mean, hello, I'm a redhead. I've got super sensitive skin anyway. And when I was, I don't know, like 55, I started feeling pinpricking. And I would have a big tub of lotion in bed with me. And it was like I was chasing dry skin all night long. This, like, you just feel like feeling like I was getting poked by a pin randomly on different parts of my body. And it just got worse and worse and worse as my estrogen levels dropped and dropped and dropped until finally I just couldn't sleep. I couldn't sleep. I had some nights where I had leftover Vicodin. I would take Vicodin just to try to sleep. And then the PEA IC study came out and it showed a significant and progressive reduction in pain by calming nerves down. And I thought, and guys, I don't like taking anything. I mean, like, I feel like I'm the queen of side effects. So I just thought, oh man, I got nothing to lose. I'm going to give it a shot. This was the first PEA product that we had. I mean, I took the IC study to this company and I said, can you make us a PEA product? And they made us this PEA 500 Pura. My skin is perfectly normal now. Perfectly normal. I might have one pinprick a week instead of hundreds a night. And the cool thing about it, and this is what the research shows, is that it has what we call a durable effect. So what that means is even after stopping the medication or stopping the supplement, the effects persist. They persist. And so I don't take it. I don't take it every day. I will go through a bottle, maybe 2 at the most. And then when I run out, I run out. See, I have a bunch of bottles. I mean, see all those bottles up there? Okay, those are all empty. Those are all just my bottles. Again, because I've taken it for like 5 years now, off and on. So I would say out of the year, I probably take it 8 months out of the year. And as soon as I feel my skin starting to get prickly again, I just start it back up. Diane says she loves PEA and lactoferrin, won't be without either. I went without PEA for a couple of weeks and felt awful, so never again. Yeah. Yeah, I just really, I feel so strongly about this. And I was talking to one of my counterparts in Europe and Italy who created some of the first studies, and she just said, this is the foundation of care now for all IC patients in Italy, is they start them with, not this specific product, this isn't available there, but they start them with PEA. And I agree with that. So Katie, PEA calms nerves down. It reduces pain and flares. And there's a blog on the IC Network website, right on the front page of our website, icnetwork.org, that goes through all the research. You can look at the research yourself. Lots and lots of research behind PEA, lots of different conditions. Excellent safety profile. That was the thing that really stunned me. Tanya says, I love PEA, but it doesn't last all day for me. It says to take once a day. I need to be patient, finding my triggers and healing. Hold on. Take 2 capsules daily. For more support and with doctor permission, you could go up to 3 to 4 capsules per day. So you could do one in the morning and one in the evening. I mean, I take mine before I go to bed. And I take 1 or 2, just really depending upon how much nerve sensitivity I have. But you could easily take it in the morning and the evening. I don't see any issue with that at all. But if you have any doubts, talk to your doctor. Kathy says, I have significant osteoporosis and need to do weight training. I've read that you shouldn't do strenuous exercise with IC. What can I do? Okay, that's so wrong. You can do strenuous exercise with IC for sure, but we're not going to do heavy weightlifting because that's going to stress your pelvic floor. We're not going to do exercises where you do this with your knees. That's going to stress your pelvic floor. And we're not going to do Stairmaster because that's going to stress your pelvic floor. So a treadmill on an angle would be fine. I usually do. I mean, I've got SI joint issues, so I'm usually at 1%, 1.5%. A lot of people are a lot higher. I'm not. I tend to keep it low. But if I'm on the treadmill, I do at least 2 miles. No biking. You cannot sit on a regular bike and do spinning, but you can do a recumbent bicycle. But you want a good workout? Row. Get on a rowing machine. That's gonna work your shoulders. It's gonna work your arms. It's gonna work your legs. It's not gonna touch your pelvic floor, and it's not gonna touch your bladder. So just to summarize, no heavy weightlifting, nothing that's gonna stress your pelvic floor, nothing that's gonna make your hips go up and down like this. So think smooth, and not sitting on a bike. Can't sit on a bike. But you can do, like you can, if you're sitting, you can do arm weights. I do arm weights all the time. I wish they showed, but I've got the sagging skin of a 65-year-old now. So you can do arm weights this way. You can do arm weights this way. You can do leg pushes sitting. You could do chest like this for sure. There's a lot of weightlifting you can't do. I just don't want you to do the snatch and grabs and carry all this weight on your shoulder and on your back. That's not going to work. That's going to be too hard on it. So start with the 2 pound weights and go for it. Tanya says she only takes 1 on the. Oh, you're doing pea leaf. Let me look at the pea leaf bottle. What does the pea leaf bottle say? They are 1 capsule a day. Is it a capsule or a pill? Let me look at it. It's a capsule. So here's the pea leaf capsule. And the pure capsule is kind of tan. Well, 1 capsule a day is 400 milligrams. If you look at the PEA studies, a lot of the PEA studies are 800 to 1,000 milligrams a day. Katie, you can get it on the IC Network shop, icnetwork.org. Just click on our shop link. So I can never tell you it's always my job to say that you need to do what the manufacturer believes is safe. And so if this manufacturer says 1 a day, I would do 1 a day. This manufacturer allows you to do more. And the studies were all like 1,000 milligrams, 1,500 milligrams. And I don't think they were 1,500, but they were like 800, 1,000, a little bit more. Again, going over to the IC Network, and you can look at the studies yourself and see what they were testing. Yeah, I mean, they're very comparable. They're just different companies. And they're both excellent companies. I mean, this is Natural Approach Nutrition, who is a great story behind this company, because the CEO of this company was actually one of my clients. He had a pelvic injury from surgery, and I didn't know who he was. I helped him for a good year or longer. And then one day he said, I need to tell you who I am. And I went, no, you don't. I don't need to know. It's fine. It turned out that he actually is a very, very accomplished business person who had several companies. And I helped him when his pain was very, very severe. And he just said, Jill, what do you need? What does the IC community need? I said, we need supplements, big time. And he said, tell me more about it. And I told him more about it. And before you knew it, we had Bladder Builder and Bladder Rest and Cystomend and P-Leaf. And I took him our low acid vitamin. He now makes the low acid vitamin. So I'm really, I feel very confident in the leadership of this company. And then P-Leaf, I worked with this company for 30 years. The Pre-Leaf product, and the two companies that have owned this. And I took them PEA and let them know about the PEA study, and they decided that they wanted to try it too, so they made P-Leaf. So two excellent companies. D says, are cranberry PACs irritating to the bladder? Yes, they certainly can be quite irritating to the bladder. I mean, we call cranberry the acid bomb. And so the formula has to be adjusted for acid level. So you've got to be, we don't recommend any cranberry products for quote unquote IC, because IC is not infection. We don't recommend Eucora or any of those. Again, it's all about your phenotype. What is your phenotype? If you have Hunner's lesions, we would never suggest a cranberry product, because that bladder wall is way too irritated and sensitive and wounded to be able to handle anything that's even remotely acidic. If, on the other hand, you suffer from recurring UTIs, then cranberry PAC products like Prevent or Allura are strongly recommended, and they've got the research to show that that's helpful. But we don't want to mix recurring UTI with Hunner's lesions or with estrogen atrophy, or certainly with pelvic floor. If you're pelvic floor driven, there's no reason to be taking a bladder supplement in the first place. We want to save that money. So again, people call me and they say, what supplement should I try? And I go, well, what's your phenotype? They go, I don't know. What's a phenotype? And then we just go through the phenotype. And I'm going to say 9 times out of 10, they're pelvic floor. Maybe 8 times out of 10, they're pelvic floor. And they often have pudendal neuralgia. And so we go the PEA route. And then for patients who are estrogen atrophy, we go the bladder builder route, or one of those supplements as a step. And guys, this is not just me. This is the American Urology Association. Listen, we don't have a lot of treatments for IC, period. We don't. And now our only oral approved medication for IC is now linked to blindness and inflammatory bowel disease, leading to colectomy. And if you look at the AUA guidelines for IC, especially when they were revised in 2014, they strongly encourage supplements in the guidelines because they rated treatments on their safety. And the problem with oral medications like amitriptyline and Elmeron is they come with a big host of side effects that the supplements don't have. And so the AUA's position was, let's start with the easy, less risky stuff before we go to the stuff with the much bigger side effects like cyclosporin. And now they revised the guidelines in 2022. They kind of reshuffled them around a little bit. But in their first line, they still suggest over-the-counter supplements. They don't do it by brand name. They don't do that. They would never do brand name. But we've got a good chunk of supplements now that we didn't have 30 years ago that we're trying, and that are more affordable and less risky than some of the over-the-counter options. And God forbid, if you don't have health insurance and you don't have a doctor, It's an option. Sheena says, I have a question. I've had consistently high leukocytes lately, high white blood cells, no bacteria, blood, or protein found. Doctor doesn't know whether there is an infection or not. Not sure whether to take an antibiotic or not. Well, Sheena, what I would do if you think you have infection, I would do a next generation DNA urine test first. A next generation DNA urine test doesn't try to grow bacteria. Instead, it looks for bacterial DNA. And it would be interesting. So it's going to find the rarer infections. And so that might be a very interesting thing to invest in to see if you might have a more unusual, weird infection like Enterococcus faecalis or fecalis. And there's a lot of different ways of pronouncing that. I was working with a patient who just had Morganella. And like 6 weeks ago, we had a patient who had pink mold in her urine. Pink mold is actually a bacteria called Serratia. So pink mold you often find growing on soap scum in your bathroom. And she had a bladder infection that her symptoms just would not quit. And urine cultures didn't find it, but Next Generation found that she actually had a very unusual infection. Who would do that? You never had that offered before? The company that we often hear about the most is a company called Microgen. There will be something new later this year, but right now it's pretty much Microgen. That's all I can say on that. I mean, I can't tell you about what's coming down the pipeline, but it's pretty exciting what's coming down the pipeline. So you would order it on their website, and then they send you the kit. It costs like $280. It is a lot, but Medicare will cover it. Some doctors love it. Some doctors hate it. Some insurance companies love it. Some insurance companies hate it. You'll often find doctors say they don't know anything about it, or they don't know how to interpret the results. I take all the emotion out of it. I just say it's data. It's just data. If you are having persistent symptoms of UTI, cultures are not finding anything, it can prove you right or it can prove you wrong. So like I had a patient call me who just said she'd been fired by her doctor because all she would take was antibiotics. She refused every other treatment. And the doctor was like, well, if you're going to refuse every treatment, I can't treat you. And her answer was, it's infection. I want antibiotics. Just give me antibiotics. He said, no, it's harmful. And he's right. It is harmful to take a lot of antibiotics over time. And so she called me very upset. It's like, what do I do? He won't give me antibiotics. I said, prove him right or prove him wrong. Do a next gen test. If the next gen test finds a weird, unusual, rare infection, then you have all the ammunition you need. But if the next gen test finds nothing, then you have to accept that you do not have an infection, that there is something else driving these symptoms. Sheena said her urologist dropped me, said there's not treating IC patients anymore. Sheena, we were talking about that at the start of this meeting. I'm actually telling patients, when you start looking for doctors, don't even say you have IC. Just say you're a pelvic pain patient. IC has become a scarlet letter, and that's growing. More and more doctors are saying they don't want to work with IC patients. And it's just because we're a very frustrating group of patients. We're difficult to work with. They have to work hard for us. And we're not surgical, and they want to do surgery. So just instead, if you got urethral pain, I would just call and say, hey, man, I got you. My urethra hurts. I'm trying to figure it out. Don't say you have IC. Sheena says, no insurance, so you'll just get it. Yeah, it's not a bad idea. I mean, if you've followed me for a while, you have to know I'm very, very focused on trying to understand underlying cause. I do not believe that the IC patient community has been served well for the last 20 or 30 years because they're just throwing meds to treat symptoms. And that's why phenotyping that we've been doing for the last 5-6 years is so incredibly important, because it will identify underlying cause and help us find the right treatment for your unique case of IC. And it is very possible that some patients have a weird, funky infection. I think it's a small group of patients, but it's possible. I'm not throwing it out, but I don't believe anybody, there are people online that are very radical who say every IC patient has an embedded infection. I'm telling you right now, that is absolutely not true. I never had an embedded infection. I had a tailbone injury. I had a nervous system injury. And if you were to come to a real in-person support group meeting, you learn very, very quickly how different we are. So anybody who paints a broad brush, says every IC patient is this or every IC patient is that, they're full of shit. Excuse me for saying that, but it's true. D said, I wish more doctors understood phenotyping. Yeah, we're in some discussions with another group about kind of what's the next big research study that needs to be done. We all understand that, listen, we already know that the quality of life of patients is pretty beat up. We already know that we flare. We already know that most bladder treatments don't work. And we already even know about phenotyping now, that phenotyping is critical. So in the research community, they're not grounded. They're grounded in the pursuit of science. They're not necessarily grounded in how do I make her life better in the next 5 years. So I think that all of our next work really has to be not with patients, but with providers. That we have got to understand why they're so resistant to caring for IC patients. We have to understand what their limitations are. And we have got to improve their knowledge about IC. So I've just been exchanging email with somebody about that right now. G says, yeah, 100%. Yeah. One of my fantasies I will tell you, so I run the IC awareness campaign every year. And, COVID kicked us in the, what. So, and then we started having fires, and IC awareness is in September, and the heart of fire season for me. And so, and we have big time fires. This is going to be a brutal year for us for fires. Knocked on wood, pray my home is safe. So basically what I do for IC Awareness Month is I write the press release, I write the campaign, I put it out there, and then I just let y'all run with it. Because IC Awareness Month is not about me, and it's not about the IC network, it's not about the ICA, it's about you. And the only way we're going to make progress is if more and more patients tell their stories, if we can get more papers to do more stories. And that's handing you a press release and encouraging you to send it to your local paper and tell your story. I mean, that's really the most important part of IC Awareness Month. But one of my fantasies has always been to have a poster that we could send to every urology clinic and every urogynecology clinic in the country. Just a like 16 by 20 poster on IC symptoms that they can post in the waiting room. I would love to do that. I've always wanted to do that. We just have never had the money to do that. I mean, I literally have paid for IC Awareness Month myself for all that. I have paid for that. Like, we don't even get donations. We rarely get donations for IC Awareness Month. And our research money right now is at an all-time low. So any donations anybody can make, any memberships you can get, just helps us do a better job. And even more importantly, you want your voice. Like, what are we missing as an IC movement? What are we missing? I mean, people say you need to be on TikTok. And I'm like, I hate TikTok. I literally hate TikTok. Before I got on TikTok, I read 3 books a week. I did 3 months on TikTok. Now my brain does not want to read a book. I can read about a half an hour before my brain goes, watch videos, watch videos, watch videos. I hate what TikTok is doing to our brains. I shudder to think of what TikTok's doing to a young child's brain and their ability to read and absorb written knowledge. I think it's very, very poor. And I experience that myself. So I don't know. We're in a really dark place. We're in a dark place. I mean, so my focus is on writing books, short books like our flare guide and our diet guide and doing videos. But I've been I have asked my advisors, should I be doing short TikToks? And they all went, no, absolutely not. You're not the funny face of IC. You're the serious face of IC. You're the one that people trust. The last thing you should do is be making fun of anything related to IC. And I agree with that. So social media right now has become this horrific wild, wild west. Cher says true. Yeah. I mean, I get more horror stories now from social media. I see patients on Facebook groups and Reddit and all the other groups. The damage those are doing to patients is stunning for their mental health. And the reason why I do this meeting on Facebook and on YouTube is to be a real support group leader here. And if we are going to be a really authentic support group, we would be in Zoom, and I wouldn't be talking, you would be talking. But so my approach is to be as neutral as I can be. I don't want to turn you away from any treatment that has the potential of helping you, but I also want to be an educator. And I really try to keep my biases out of what I say. I try to be very, very, very careful. I really sincerely do. And that's just only because I've done this for so long. And guys, listen, you got me maybe another 4 years. That's it. My brain is already saying I want to be on a beach. It's getting a little bit harder I love my job, but I would be very happy when I don't have to be responsible for technology. The technology makes me bonkers. If I could just have a phone and talk with you on the phone, that'd be great. Zanya says, my mom was telling me about how when she was diagnosed, there was no genetic connection, and there are more studies. And 20 years later, I just gotten diagnosed and we're trying to learn from me. Zanya, you're not the only one. But, and I have the latest genetic study. Okay, I just read it 2 weeks ago. Hold on. Oh, what was that? Okay. So we have phenotyping. Okay. Now, Sherry, it's tiny. It's tiny. So remember, we have our phenotypes here. 87% of patients are pelvic floor driven. Or 87% of patients show very clear defined pelvic floor muscle problems. That's not genetic unless there's a congenital birth defect that gets passed down, okay? Is a Hunner's lesion genetic? I don't believe so. What the research shows is that it's a viral infection. We're looking at neuroinflammation or viral infection. The genetic window is either going to be for bladder wall driven without lesions, and I literally just read this study. Okay, what's the right word? Where there may be a cell proliferation genetic It's like a skin growth problem where the skin is not growing the way it should grow. And they found some markers. Oh God, where's the study? I hate relying on my memory for this. I just freaking read this. And I try to save all those. Hold on. You know what? I don't think it printed. I think I saved it on my iPad. Because I read this either last week or the week before. I actually read it out loud in this meeting. So they found this tiny correlation with another medical condition that involved the proliferation of cells and skin healing. Okay, that's the best way I can describe it. That's the best way that I can describe it. Now, the other familial correlation that we've been able to make, Sherry, do not beat yourself up, girl. Do not beat yourself up about this at all. Genetics are genetics. You have no control over your genetics. They came from your parents. They had no control. It came from their parents, etc. So don't you dare start blaming yourself for any of this. We all are given the gift of our ancestry. So I once worked with a family where every kid had a problem and they were all adults. So one kid had IC, one kid had IBS. Oh, one or two had migraines, and they were in the widespread pain group. Absolutely in the widespread pain group. And they all had anxiety disorder. And they didn't inherit a condition. They lived in a home that was incredibly dysfunctional, and they all had injuries to the central nervous system from violence in their home. So that's a filial connection that did not involve genetics. It involved inherited trauma that affected their central nervous system. I hope that makes sense. Katie said, I'm doing post-tibial nerve stimulation. Does that work? Work for me. I had my first 2 hours without pain at week 3, and I had my first day without pain at week 7. I did it for several months, and I do believe that post-tibial nerve stimulation broke me out of my terrible flare. I still have my tattoos from it because they gave me tattoos back in the day. I don't know. There's a little tiny black mark right there. It's right there. You know what? It makes me look like my ankles are swollen, but they're absolutely not swollen at all. Nope, there's no swelling there at all. I touch on it. Nope. I'm just paranoid about how my body looks. Oh, this one's easier to see. See that little black mark right there? So you do the ankle stem 3 fingers above the ankle bone, right? So then we're on center line, and then it's basically 1 finger below center line. I had mine done by the guy who invented it, Marshall Stoller at UC San Francisco. So that's straight from the boss. And he did those tattoos. Dee said, what practitioner would do that? Is the name of the company that's doing it now is called Urgent PC. So you can go to their website and they have a list of practitioners. Urology clinics do it, but there's usually like a nurse who's trained to do it. And I have a video of it on our website. Oh, actually, that domain name didn't work. Here, hold on. Hold on. The name of the company Oh, it's right on the tip of my tongue. Oh yeah, it got sold. That's why. Okay, so the company that does it is now called Laborie, Laborie. So I'll give you the link. There you go. And for those of you on YouTube, if you want the link to the Urgent PC, it's right there. Diane said, do you think it's safe to do PTNS for years? I've been doing it for 1.5 years now. Can it cause neuropathy with long-term use? I would be very interesting to see what the research from the company says. I did it for probably, let's see, I started on my birthday in July. I did it July, August, September. And then I did it on my own for probably another 6 months. And do I believe that it gave me neuropathy in my feet? Yes, I do. I had a weird nerve function test. I was having a lot of foot pain, but I also was a tennis player and I have a lot of foot pain from that. But my nerve function tests were very weird and off the charts for my feet. And so the only thing I could think was maybe it did, but I don't know if that's a trend. Here, let's see what they say. So I'm on their website. 50 studies demonstrating safety, efficacy, and preference. 12 years of clinical use in thousands of clinics with over 1 million treatments with no severe side effects. And that's very, very true. When you look at the FDA data for this ankle stim, there are very, very few serious adverse events. But if you turn it really high, I mean, ankle stim should never hurt. Urgent PC should never hurt. If it's so high that it's hurting, you are damaging nerves. So I do know one patient who thought the more it hurt, the better, and she did fry her feet and end up with pretty bad nerve damage. Let me just see long-term use. Let me see if they have anything on their website about long-term use. They do not. Is PTNS safe for long-term use? Studies show that patients can safely maintain symptom improvement for up to 24 to 36 months using periodic long-term maintenance sessions, typically once a month. So not every day, but more once a month. Here's a 2024 study. Here, hold on. Only 1 in 5 do PTNS for long-term management of their symptoms. Yeah, I mean, I think that that's reasonable. Kathy says, I bought pea leaf. How long does it take to feel a difference? Well, I felt it probably within 3 or 4 weeks, maybe even earlier than that. Katie said, what site is this? What do you mean? Our website's icnetwork.org. I got to fix that logo. That's the link I put above. That's the Labori link. Anne says, who reads the microgen if your doctor doesn't want to do it? You can work with the company, and they can find a doctor to interpret results if they don't want to interpret them over the phone. I mean, next gen test results are really easy to interpret. So you get a graph, and it shows what they found and what antibiotics will kill it. And they give you percentages. So they found Enterococcus at 12%. They found E. coli at 80%. Okay. If you have E. coli at 80%, you got an E. coli infection for sure. But if it's little percentages, usually not an issue. They're also going to identify good bacteria like lactobacillus, some lactobacillus crispatus and things like that. So. All right, my friends. Well, I think I'm pretty much done. Oh, I feel like I need to go walk. I haven't walked yet today. I've been having a lot of, I kind of went crazy with fruit this week. Because again, I'm not bladder centric. So I was basically eating just fruit and vegetables and chicken. I wasn't eating any carbs. And I ended up with a wicked case of the runs. I did. So I am. I have to rebalance my diet. I have typically learned. Usually, this happens in the summertime, that I can't just eat vegetables and fruit. My body needs starches. So I feel like I want to go walk, and then I have to make something starchy for dinner. Anyway, all right, guys. Well, listen. We'll see you next week, but not on Easter Sunday. But I plan to be here next week. Knock on wood. Knock on wood. If anybody needs help, come on over to the IC Network. And it would really help if you became a member of the IC Network. You subscribed. Please come on over and like our YouTube channel. Follow our YouTube channel. Follow these channels so that we can just keep getting the word out. I hope that you see that I'm really sincere in what I'm trying to do. And just trying to help. All right, my friends. I'm going to say goodbye to YouTube first. All right, I'll see you later, YouTube.